on the third day of our ongoing FDP. I am Dr. Saurabh Bharadwaj, Assistant Professor from MNIT Allahabad, and your today's session coordinator. We now begin our first technical session of the current FDP program. It is an absolute honor to invite our esteemed speaker, Dr. Shivangi Giri from NIT Raipur. Dr. Shivangi Giri is an assistant professor in the Department of Biomedical Engineering at the NIT Raipur. She holds a PhD from MNIT Allahabad with her research focusing on gait analysis in hypogravity environments using musculoskeletal modeling. Her areas of interest include biomechanics and rehabilitation engineering. A gold medalist in MTech, she also has industrial experience at Infosys and postdoctoral research experience at IIT Delhi. Dr. Giri has presented her work internationally, including ISB 2019 in Canada and WCB 2018 in Ireland, and has published in reputed journals such as ASME's Journal of Biomedical Engineering. We are privileged to have her with us to speak on the topic musculoskeletal modeling. Dr. Giri, we warmly welcome you and request you to kindly begin your session. The stage is all yours.
Thank you, Saurabh sir, for introducing me to the participants. A very good morning to everyone present here. And without further ado, let's start the lecture. So I'll be going ahead and is everyone able to see my slide?
No, ma'am. You can share your slide.
Yes, sir. Okay. Done that. Okay. I'm doing it again. Now, is it visible to everyone?
It is loading. Yes, ma'am.
Yes, ma'am, it is coming.
Okay.
Ma'am, please put it on the
slide mode.
Slide mode. Yes.
The topic for my presentation is musculoskeletal modeling and biomedical analysis using OpenCell. First of all, before beginning the computational modeling of a musculoskeletal model, let's first briefly go through what a musculoskeletal system is. So the reason our body is able to move is because of the muscles and because of the bones. So in an adult body, there are approximately 206 bones and 600 plus muscles, right? Even though the children have 300 plus bones, but they fuse together as they grow up. And including, apart from the bones and the muscles that are in the body, there are also ligaments, cartilages, bursae, and especially the joints. Because of the joints, we are able to have some specific range of motion, and that is why we are able to move. Because two bones join together and they form a joint, and that is how the motion is brought about. And it is very important because the entire musculoskeletal is the reason that you are getting the support, you have a definite form, you have stability, and you're able to move from one point to another point. Now, I'm just going to go briefly. I'm going to touch upon the skeletal system and muscular system in very briefly. So let's start with the skeletal system. Now, the skeletal system has two types of bone tissues. One is the compact or cortical bone, and the other one is spongy or trabecular bone. Now, as you can see in the figure, as you can see in the figure on the right hand side, the brown portion which has small irregular shape inside of it, that is the cancellous or the spongy bone. All right. And this is where most of the formation of the bone cells happen. And that is how this is where the growth is happening in a bone. And the rest, the white portion which you see, which is outlining the entire bone, is the compact bone. That is the hard tissue. So it has already been formed and it is there to give you support. The cancellous bone is to absorb the stress. It is acting as a shock absorption tissue, and then it plays a very important role in load transfer without breaking the bone. So the combination of these two, the cortical and trabecular bone, is very essential for load transfer as well as to maintain the integrity of the bone while it is under stress. Now I'll be not going into the microstructure of the bone. That itself is going to take a lot of time. So let's move ahead and talk about the classification based on shape. So we have the long bones, the humerus, which we have in our arms, the tibia, which we have in our feet, the femur. The femur is the longest bone. The short bones are the carpal bones, which we have at the wrist and at the foot, at the around the ankle joint. And then we have the flat bones, the bones of the skull, the sternum, the rib, the part of the rib, and then the scapula. So they are the examples of flat bones. And now, obviously, the irregular bones, which are part of the vertebrae. So the vertebral column is formed of irregular bones. And there are other also type of bones which they are not, most of the classification that is given in this particular slide incorporates major bones in the body. So this is just to give a brief idea that this is the classifications we have based on the shape. Now let's talk about the degree of freedom that is there for each particular joint in a body. So let's start with the pivot joint. Let's start from left and then we'll be slowly proceeding towards the right side. So the pivot joint, as you can see, is the joint that connects your head with your vertebral column. So it's a pivot joint. Pivot means you can only have 1 degree of freedom. That is, you are moving your head like this. So it's a pivot joint. All right. So you must be thinking that we can even move our head this way. But this connection is happening between some other two bones. That is not the connection which is happening between the head and the vertebral column. So even in the vertebral column which is being connected to the head, it has got 7 cervical bones. So these 7 cervical bones, the 4th bone is connected to your head, but the 6th and 7th bone which is connected, that is because of the connection between the C6 and C7 that you are able to perform this movement. So the pivot joint is between the C4 and the head. Now let's talk about the hinge joint. It is a very common joint. Hinge joint, as you can see, is the elbow joint. So it's a hinge joint. You can perform like this. So it's a hinge joint because beyond this you cannot move any further. Again, if you try to move it sideways, it's very difficult, and this is being restrained because of the ligaments and because of the muscles. That is why the soft tissues which are covering the joint, you are not able to move like this. You're only able to move like this. So this is the greatest range of motion that you can see in an elbow joint. So particularly, even though there are slight change of slight degrees of freedom in other planes too, but the biggest range of motion that is possible in a hinge joint is only single degree of freedom. That is why when we model elbow joint, we are only restraining it to 1 degree of freedom. Likewise, hinge joint is also present in the knee. Even though we can move our knee slightly in other planes as well, you can twist it. And even though there are, because of the cartilages that are there, the ligaments that are there in the knee, you can have translatory motion as well, because the knee is connected like this. The femur is like this and the tibia is like this. So slight movement can happen between the ligaments. So this is the translation motion. But since this motion is very slight, so when we are modeling, what we are trying to do is we are trying to make a simple model which does not have complex computational equations, that is not increasing the computational time. So in the end, what we are choosing is that if we have to actually represent a joint, what is the greatest range of motion that particular joint is making and undergoing? And also, if in other planes there are motion, is it significant? For instance, if I'm just targeting on walking, and in walking it's a sagittal plane activity. So sagittal plane activity, I am interested in that particular plane of motion. If my joints are having significant range of motion in that particular plane, I am going to consider only that motion. The rest motion in motion in rest of the planes, I'm going to ignore it, just to make a simplified model, because my research question is based on only activity which is very simple as walking, and then I'm just going to target on the sagittal plane only. Now let's move on to the next type of joint, which is a saddle joint. Now saddle joint is something that is between the carpal bones. So carpal bones is basically they are fixed on top of each other. It's just like saddle. Saddle means that it's similar to someone sitting atop a horse. So that is how it has got its name. So it's basically these bones are on top of each other in a position that they look as if one bone is riding on another bone. So that is how it is got its name, saddle. And this has 2 degrees of freedom, because we don't know whether, because here you think that this is just this, but even here we can do some kind of motion like this, because this is also a carpal connection. So the 1 degree of freedom in one plane is significant, and in other plane it's slight, right? So then again, depending on the research question, we can actually simplify the range of motion which we are going to assign to the joint configuration when we are modeling. Now let's move on to the other joint, which is a planar joint. So it's like 2 surfaces are moving like this. So it's basically a translation motion. And this here again, it has 2 degrees of freedom. So it is sliding like this, and it could slide like this, right? Now the next is the condyloid joint. Now condyloid joint, they are flexion and extension and adduction, abduction. So adduction is when you are moving for instance, if you are moving your peripheral limb closer to your midline of your body, which runs like this from the center through the center of your body. If you're bringing your hand closer to your body, then it is adduction, and if you're moving away from the midline of the body, then it is abduction. So condyloid joint, basically what it does is it kind of allows this motion as well as this motion. Now this is not the example of a condyloid joint. Now condyloid joints are present basically between your ankle joint. So ankle joint is something because you can even move your foot like this, and you can even have this kind of motion. So it's a condyloid joint, right? Now ball and socket joint. So we have got 2 ball and socket joint in the body. One is the glenohumeral joint, which is the shoulder joint, and the other one is the hip joint. So it has 3 degrees of freedom. How 3 degrees of freedom? Because you can move your hand like this from the shoulder, and then you have this abduction adduction motion, and then you have this internal and external rotation. So that is, and since these are ball and socket joint, they do not have any kind of translation motion. No translatory motion is possible, because if you imagine translation, then it would be like disconnecting the joint from the body. So that is not, I mean, we don't want that. So the ball and socket joint only has 3 degrees of freedom, and those 3 degrees of freedom are only for the rotation. Now, that was just a brief about, because if we have to model something, we have to actually consider, if we are not considering because the model or the biomechanical platform I use for modeling, it does not really depend on the anatomical structure, but it does depend upon how you are choosing the degrees of freedom for each joint configuration. So that is why I went ahead and give you a brief idea as to how we are going to define joints, and how we are going to pick, if according to the research question, if we are only going to focus on the lower limb, so it's the lower limb that we have to focus on more. We have to focus on making the model more realistic as compared to the upper limb, because in the upper limb maybe we can constrain the motion, maybe we can have assumptions without being worried that it may going to affect our results. So we can just go ahead and focus on the lower limb. Now we have talked about the skeletal system. Now let's move on to the muscular system. So the bones cannot move by themselves. It's because of the muscles that are attached on the bones that the motion is happening. So you need to be very much well versed in the location, in the anatomical structure of the muscles, because you should understand how the muscles are connected to what is the attachment sites of the muscles that are on the bones, because that is how you start the modeling, because this is the connection, the first connection, the origin from where the muscle is coming out from the bone, and then where is the insertion? Is the insertion happening on the same bone itself, or is the insertion happening on another bone? Because if you are able to move this hand, you are able to move this hand because there's this one muscle which is connected here. It starts from here and it is connecting here. And when it contracts, you are able to pull your arm closer, your forearm closer to your upper arm. Right. So before going into the depth of how muscles are modeled, let's just see quickly see what all composes the muscular system. So skeletal muscles, because of the skeletal muscles, you are able to move. The skeletal muscles are they are the only voluntary muscles that I mean, you can actually control their contraction. And like I said in my first slide, that human body is composed of more than 600 muscles. So our human body is a muscle redundant system. So in a group, there could be 2 to 3 muscles working together. So that if one muscle is, for instance, because of some pathological condition, that muscle is not functional, it's not working properly, there are other muscles that can compensate for the loss of that particular muscle's functionality. And muscles, when they are when they connect to the bones, they are doing that using a tendon. So tendon is a passive structure. The only active structure in our body that is responsible for creating force so that you can move from one place to another is muscles. It's only because of the muscles. The ligaments, tendons, cartilages, all are passive structures, and their main work is to protect the active muscles, your active element, as well as they restrict to some extent the range of motion. Because if there had been no restraint here, and if I would have been able to move like this, a rupture of joint would have been caused. So it's because of the soft tissues that we have some restricted range of motion, and that is how our body is made up of, so that we are minimizing the injury which may happen due to that. Is why in athletic performance, if you are straining your ligaments too much, or if you are maybe pushing your body too much, it may so happen that maybe for instance, let's take an example where you're kicking a ball very hard. So it might so happen that your knee ligament, the anterior cruciate ligament, may get fractured, it may break. And because of that, because that is the ligament which is anterior to your knee joint, and that is what is preventing your knee joint from I mean your tibia from going farther away from your femur. So because of that impact, because you have kicked the ball so hard, because of that impact, what is happening is that ligament which was able to only confine the motion from here to here, because of that jerk, that sudden impact, it is the motion happened like this, and because of that, this ligament has ruptured. So that is why in athletic, for athletes, we design or we recommend saying that this is the activity you should not be performing. And if we keep on tracks that the ligaments are in place and that you don't have a sprain, because if there is a sprain, the athletes start treating it, because the sprain might get worsened as they keep on performing their sports. Now the muscle, now it also depends upon because muscles form a large part of your body weight. So depending on whether you are a male or a female, it depends. It also influences the muscle weight. So for instance, the muscle makes up around 30 to 35% in women and 40 to 47% in men. That is the body mass percentage which is being occupied by the muscles. Also, it depends whether a person is fat or obese. But then again, the entire that is the fat layer that is building up on top of the muscles. Another case is where a person is a bodybuilder. There, the muscle mass is going to be different. So these percentages are for normal weighted healthy men and women. Now, apart from skeletal muscle, we have smooth and cardiac muscles, but these two muscles are involuntary muscles. So the only muscles we can control is skeletal muscle. Now, just to give you a brief idea about the structure of skeletal muscle is, so they are being controlled by the somatic nervous system. Now, somatic nervous system is, the chain which links your brain to your skeletal muscle. So that is the defined system where these nerves are only being connected to the skeletal muscle. So we have the term we use is the somatic nervous system. Now, skeletal muscles, they are multinucleated. Now, there is a reason for these muscles to be multinucleated. For instance, if I have to raise a finger like this, now this means contraction because muscles only contract. They cannot extend. They contract and then they relax. So, and when you are moving your finger like this, so it is muscle is contracting. How is muscle contracting? If you are able to do like this, that means the muscles posterior to this finger, they are contracting because this is shortening. That is why you're able to lift your finger like this. So the production of force or the requirement of force or the requirement of motion can happen at any point, right? Like for instance, I want to raise this finger like this. So if my muscle had been only one, had been containing only one nucleus, it could not have produced the force instantaneously. Because of this multinucleated structure, it can produce very fast. Because the closer, for instance, if this is the joint which I am flexing, this. So the cells right here, they must be having the nucleus right here. If, for instance, if I have a muscle cell like this, so this is the nucleus right here. So it will start saying, okay, I can sense some kind of voluntary motion here. So start providing the energy. So that is why it is multinucleated. You don't have to wait because our body does not, when we have to actually go and pick up something, it takes about, less than millisecond to actually decide on how we are going to start the motion. So for that energy to be provided instantaneously, you need to have more than one nucleus. Now the fibers are long, they are cylindrical and multinucleated, as I said, that why we need to have muscle cells, why we need to have multinucleated muscle cells. Also, they are smaller in diameter and larger in large muscles. Obviously, if your muscle is this much big, so the diameter of these fibers would be comparatively bigger as compared to a muscle which is this much small. So it's like a scaling that happens between depending on the size and volume of the muscle. In general, they are about 1 millimeter to 4 centimeter in length, each muscle fiber. Now, let's talk about how the muscular system produces contractile force. Now, the basic contractile unit of a muscle is not muscle, but a muscle fiber is sarcomere. So, sarcomere is the basic functional unit over there. As you can see in this picture, so the muscle which is being shown here is the biceps femoris muscle. The biceps brachia muscle of the upper arm. And then if you go inside the muscle, it has muscle fiber bundles, and then each bundle has its own fascicle, and then each fascicle, so it's like each fascicle has these myofibrils. Now each myofibril has combinations or a stack of sarcomere, right? And each sarcomere has two main proteins. That is because of these proteins that the contraction is possible. One is actin and the other one is myosin. So myosin is a thicker protein and actin is a thin protein. So it's because of the sliding of actin and myosin, because as soon as they form a cross bridge, so the area which is overlapping, it's because of this connection that the contraction happens. Because contraction is what? When you are bringing your this segment closer to your this segment. So it's basically the sarcomeres which are present over here at this particular length. So they're like this, right? And as soon as the contraction begins, they are overlapping. They are coming closer together and they form a bond. And because of this bond formation, energy of contraction happens. So it's because of this they are able to contract, and that contraction which happens, they're also binding each other together. And once the contraction is no more needed, they are going to go slow. They are going to go back slowly to their original position, and that is how the cross bridging happens, and that is how the muscle contracts and relaxes. So the theory that is forms the basis of muscle contraction is sliding filament theory. Now let's talk about, this is very important because all muscles, they have different type of fiber orientation. All muscles do not have the same fiber orientation, and because of the orientation of the fibers, the direction of line of generation of force is different for each muscle. I'm not talking about muscle group but muscle. So like I said before, one muscle group can have more than 3 to 4 muscles, and each muscle, they are only placed inside a group if they are doing the same work, same work, as if um for instance, if I'm flexing my arm, so this is because of this biceps, because as soon as you raise your arm, you will feel a bulge right here. So it's because of this muscle that you're able to move your arm like this. Now this muscle is not just, it does not just attaches here, it attaches, it starts from here, but it has its insertion at this, in this other segment, and that is why the segment is able to come closer to the body. Now, this biceps brachii muscle, it has some kind of orientation. Now, the orientation, how do we decide how the direction of the muscle force is being generated? That is depending on how the fibers are oriented with each other, and also with respect to the tendon. Now, tendon is the element or the structure that is connecting your muscles to bone, right? So the white part which you can see in the images on the right hand side, that is the tendon, and the red part is the muscle. Now the more force is being, it is always generated at the muscle belly. So muscle belly is the volume where you experience the maximum muscle mass. So that is your muscle belly, and most of the time it is almost in the middle of the muscle. Now let's talk about the hamstring muscle, the first muscle which you can see on the in the image on the left hand, on the right hand side. So the hamstring muscle is the muscle which is placed posterior to your thigh, and it has a simple parallel arrangement. So there are two terms which we are concerned about when we are modeling muscles. One is the anatomical cross-sectional area, and the other one is physiological cross-sectional area. Now, anatomical cross-sectional area is just the cross-section where you are cutting the muscle in the transverse direction. So you're just cutting the muscle from the middle part. So that becomes your anatomical cross-sectional area. But physiological cross-sectional area is if you want to cut the mid of the fiber. So the fiber, as you can see in case of the hamstring muscles, they are in parallel. They are so if this is the muscle, they are arranged like this only. So it is in parallel to the muscle orientation. So the anatomical cross-sectional area and the physiological cross-sectional area for the hamstring muscle is going to be the same. But if you see the rectus femoris, the quadriceps muscle, which is anterior to your thigh, it has a bipinnate structure. Now, bipinnate structure, pennation means the angle which the muscle is making with the tendon. As you can see, it has got two parts. So there are two. It is the fibers are oriented in two directions, right? So the anatomical cross-sectional area is straightforward. You just go ahead, you pick that muscle, and you are just cutting it from the middle. So that becomes your anatomical cross-sectional area. But that does not mean that it is also cutting the mid part of your fibers, as you can see right here. So the light blue here is the anatomical cross-sectional area, but the physiological cross-sectional area is going to be this. It is going to run through across the midline of the fibers. So the fibers are oriented at an angle. So this angle forms a basis of how your muscle force is going to be directed. So in order to determine the direction of muscle force generation, because that is how the bone is going to experience the pull, you need to have that idea, the vector of the force pull. I mean, how is your muscle going to, how, because muscles are basically what? They are going to generate force, and the force are going to act as vectors on your bones. So you need to have the direction as to, and the angle at which the force is going to be generated. So that is a physiological cross-sectional area is a very important aspect to know before you start muscle modeling. So the two types are parallel arrangement, because in the hamstring muscle, the tendon and the muscle fibers, they were at 0 degrees. They were parallel to each other. But in the pinnate arrangement, the fibers are always at an angle. Not the muscle, but the fibers of the muscle, they are at an angle with the tendon. Now, again, these are some of the shapes of the skeletal muscles. So, there's fusiform, the biceps brachii. This is the biceps brachii. This is a fusiform structure. So, it's a dumbbell shaped. So, it starts from a point, and then it starts from a point, forms like this. Okay, and then it's going like this. Again, the parallel structure, rectus abdominis, it is present in your trunk section. Now, pectoralis major, this is again your trunk section muscle. The palmar interosseous, it's a unipinnate, as you can see. Why unipinnate? Because it's fibers. They are not branched out like the quadriceps muscles in two directions. It just has one direction, even though it is forming an angle with the tendon. Now, multipinnate is the deltoid muscle which we have across our shoulder. So a deltoid is not it's just not one direction muscle, but it is three muscles. It has anterior deltoid, then lateral deltoid, and posterior deltoid. So there are three sections of the deltoid, and each section is having its own multi-pennant structure. And then circular muscle, the orbicularis oculi, which is present in the mouth. Now, the characteristics of skeletal muscles is contractility, because muscles only can contract. Extensibility can only happen when the muscle is relaxing. During this time, there is no muscle activation that is happening. It is just going back to its place. And if you are going to stretch it further, it is because of the passive structure which is present there. Passive structure could be the layer which is covering the muscle fibers. Because of that stretch, it's just going to stretch like a rubber. And that is how you are able to move your arm further down. It's not because of contraction that is happening. So if I'm going to go if I'm going to pick up a dumbbell, and then I'm going to release it, so in releasing I'm not going to use much of my energy, because first of all the gravity is acting. So anyways your arm is going to go down on its own, when you, because we find it hard to pick the dumbbell up, but we do not find it so hard when you're releasing it. So it is mainly also one part is because of the gravity, and also when you're releasing it, your muscle is not working because it is not contracting. It is only going to extend, and the extension is going to happen because of the passive structure that is surrounding the muscles. So it's like the sarcomeres are back in their place, but again that stretch is happening. Now that stretch is happening because of the passive structures. The contractile element there is intact. It's because of the passive structure that is covering each muscle fiber. So there are thousands of muscle fibers. So there are thousands of passive structures. So thousands of passive structures clubbed together, they give you that rubber-like extensibility. And the third one is elasticity, obviously, because after contraction, the muscle has the property to regain its original shape. And excitability, why? Because unless and until the nervous system sends a signal through that somatic nervous system, your skeletal muscles are not going to get activated. It's because it exceeds some kind of threshold after getting neural excitation that the muscle activation starts happening. So these are the four main important characteristics of a skeletal muscle. Now there are types of contraction. It's not just that it's simple like this. It could be three. There are three types of contraction. The first one is something which is very common. So it is the concentric. Concentric is where it is contracting and where the length is changing. Length is changing. That means the distance between this segment and this segment is getting reduced. So it's a concentric contraction. Now isometric contraction is when I'm pushing my hand towards, I mean, I have kept my palm on the wall and I'm pushing it, right? The wall is not going to move. Also, there is not going to be any change in the length of my arm, but I'm going to get exerted because I'm trying to push the wall. So you are going to experience fatigue. So that is the type of contraction where the segment length is not changing, but even though you are getting fatigued, and even though your muscle is, even then your muscle is generating force. So that type of contraction is isometric contraction because there is no change in length. That is why the term isometric. Third is eccentric contraction. Like I said, when we have picked that dumbbell and when we are releasing it, so the lengthening of the muscle is happening. When the lengthening of the muscle is happening, the muscle is not undergoing contraction because there is no involvement of the active contractile element. It is because of the passive structure. So that kind of is eccentric contraction. Before, it's common in any exercise protocol that they usually ask to stretch your body before beginning any kind of exercise. So stretching, what it does is, it actually, if you're stretching it, basically you're trying to, for the passive structures, they are kind of being stretched, and they are kind of being involved so that they maintain their elasticity. If we are not, for instance, stretching and then we start the exercise, it might so happen that the passive structures, they have lost their flexibility, elasticity. So you need to keep on stretching so that they are also involved, because you are only contracting, so your active element is getting involved, but you are not doing any kind of stretching, so your passive element is not getting involved. So in order to involve the passive elements too, you need to first try to do eccentric contraction before beginning any kind of exercise, and then you should be doing concentric contractions. Now, this was about the body. Now, why we need computational musculoskeletal modeling platforms is, first of all, it is very challenging to obtain invasive data. So if I want to get muscle activations from deep muscles, I cannot do that, right? So why not create a virtual representation of a body or of the subject I want to obtain data from? Secondly, if, for instance, if I want to analyze the cause of knee osteoarthritis, so I cannot do that on a subject. It will raise ethical concern. So the best possible way is I can create a digital twin of that particular person, and I can model using some kind of imaging data. I'm going to get the personalized model of that subject, and then I'm going to analyze, okay, so the muscles should be looking like this, the muscles should be activating like this in a normal person, but in a knee osteoarthritic arthritic or osteoarthritic patient, the muscle activations are not happening, the co-contractions are not happening the way it should be happening in a normal healthy person. So for the all the deep or for all the invasive analysis, we cannot always operate on a subject and see what's going on inside. So the best alternative is to model a computational musculoskeletal model and to represent or to actually have that model behave in a realistic and in a physiologically accurate manner as that of the subject. So that is where you need to understand, you cannot always assume assumptions, because if you're going to have a lot of assumptions while creating a model, the outcomes that that model is going to produce is not going to be realistic, anatomically realistic. So how are you going to apply those outcomes on a real subject? Okay, then again, analyze and optimize athletic performance. Like I said, what is the force at which that ACL is going to break? If I can determine that, then I'm going to ask the athlete to not go beyond this or to not kick the ball so hard. It should be within this limit. So that is how the training protocols are designed for each athlete. Now, the planes of motion, I was talking about the sagittal plane. So as you can see on the right hand side, the blue shaded plane which you see is the sagittal plane. It divides your body into left and right halves. Okay, the axis of the plane goes right through the middle of the body, and it divides it into two. That is why when we are walking, it's like your left and right, right and left, right and left. So it's in this plane of motion only. It's not, you don't go like this, you're going like this. So this is sagittal plane of motion. Now the frontal plane of motion, also known as coronal plane, it divides your body between anterior and posterior parts. And the third is the transverse plane. So transverse plane divides your body into upper and lower portions. Now, before beginning any kind of data capture, we ensure that the subject, the first static trial or the first position is the anatomical pose. So anatomical pose is the pose where the person is standing uh, upright with the face facing forwards and the hands by his side, by his or her side, and the palms should also be facing anteriorly. The palms should be uh, facing the front as well, and with the feet uh, brought together. So that's the anatomical pose before beginning any kind of data capture. That's how we ensure, because like I said, when we have developed a model, when we are developing a model, we may take some other subject data as reference. But if we have to use the same model to model a behavior in another subject, what we do is we actually have to scale the dimensions of that model and also the parameters, the length of the muscles as per the other subject's anthropometry. So this anatomical pose helps to do that. So when that person is standing still and in that particular position, the markers give us the idea of the segment dimensions, and because of and using those segment dimensions, we can scale up or down the generic model which we created using some other subject's data set. Now the joint configuration is, so we talked about different type of joints. Now if we have to model a joint, how are we going to do that? So as you can see on the left hand side, you see two structures. One is the green structure and the other one is the blue structure. So the green structure is the parent body. For instance, if I have to form a knee joint, so my parent body is the femur body, because whenever we are adding joints, we are going from up to down. The approach which we follow is from up to down. So the first bone segment which we are going to encounter from up is femur. So femur becomes your parent body. Now you have to add a joint because the other child body is going to be tibia. Now tibia and femur cannot start moving against each other like this. They need to have some kind of connection, some kind of joint configuration. That is the knee joint. Knee joint itself, it's only a joint. It is not a structure. It is a joint. It is a joint which is being formed between femur and tibia. Now, in order to get that joint made, so your parent and your child body should have a connection, a kinematic connection. Kinematic here means you are going to assign the number of degrees of freedom or the number of planes that particular joint can move in. So in this case, most of the time for the knee joint, we only assign 1 degree of freedom. The rest degrees of freedom are either constrained, or maybe we can actually give them a prescribed motion compared to the with respect to the motion that is happening in the sagittal plane. So to keep it very simple, let's just imagine that we are going to just assign 1 degree of motion to the knee joint, where the in the parent body the red P, and in the child body the red B, that is the connection, or that is what this link shows, the connection, the kinematic connection or the degree of freedom that are being assigned to this particular joint which is being formed between the femur and the tibia. Likewise, we define joints for all the, in the model that we are creating. So as you can see in this figure, you see no hands, right? So because in this model, or for the model where this model was taken up for a study which only focused on the lower limb. So the activity, the hands basically, the weight of the hands were basically clubbed in the trunk section, and the movement of the hands, it was seen that it does not create it does not create much significant activation or much significant impact on the lower body muscle activation. So that is why the limbs were removed. So that is one of the simplification which we can do after comparing it, because we compared it with the body which had hands, and compared it with body which did not have hands. So the activity which we were focusing, we could see that the movement of the hands were not having much impact on the activation of the lower limb muscles. So we I mean, we removed them, we did without them. Okay, moving on, the muscle model. Now, the muscle model that has always been, I mean, it is one of the most popular models. There are other models, but this is the model that is constantly being used by till now. Even though this model was first proposed by Hill in 1938, but it is still relevant. The researchers are building upon this muscle model only, and this muscle model was given or it was proposed on the input and output behavior of the muscles and which were obtained experimentally. So all the graphs and everything, the mathematical model itself is the basis of that mathematical model is through experimentally obtained data and different type levels of complexity because it ideally composes of three components in the next as you can see here also. The first component is the contractile muscle fibers, which is the representation of the sarcomeres. Because of the sarcomeres, your muscle fibers are able to contract. Okay. Now the parallel elastic component which you see is the passive muscle layer. So it could be sarcolemma, it could be the endothelium or the basically the covering, the outer covering of the muscle fibers, the outer covering of the muscle itself. So that is the parallel elastic element, because obviously when your muscles are contracting, your passive elements are also moving along with them, right? Because if you are going to stretch a rubber, for instance, the entire rubber is going to get stretched, right? It is not that only one segment of the rubber is getting stretched and the others are not getting involved in the stretching. So that is not going to happen. The entire muscle is going to contract and it is going to come back to its position. So while that is happening, the passive elements, even though they are not producing active contraction, but they are moving along the stretch and then they are going to come back. So it's a parallel arrangement. So there's this contraction that is happening, and with that contraction, the passive structures are also moving along. And then at the if you see, apart from these two elements, there is another series elastic component. Now, this series elastic component is the component that represents the connection between the tendon and the muscle fibers, because the tendon and the muscle fibers are connected in series, because this is the entire muscle and this is the tendon which is being attached to the bone, right? So if my muscle is contracting, the tendon is going to come like this, and then when it is relaxing, it is going to go like this. So it is happening in series, right? So this is the three component, the very simple three component hill type muscle model that was proposed, and it is still relevant and it is being used here. So this is the hill muscle model that is it's something. I mean, I'm not going to go into the entire mathematics of it, but just to give an idea, the total muscle force is going to be the contractile force as well as the passive force. Obviously, because as you can see in the figure, the PE here is the passive component and the CA is the contractile element. And the SE is the force that is going to act along the tendon. So tendon also does not generate any force. It's only the CE part which is generating force. Now, the total force is going to be what? It is going to be the FM, the total force, which is PE plus CE being generated. Now the PE, you must be thinking, how is it generating force? It generates force because of the length, not because of the activation. So even with the length, the sarcomeres are getting overlapped because they are in this position. Even when they are moving like this and this, it is going to create some kind of force, even though the muscle contraction is not happening. So the muscle force is created by both the passive and contractile elements, and since they are connected, this particular muscle is connected at an angle alpha with the tendon. So the total force which is going to be transmitted to the bone via tendon is Fm cos alpha. So that is all you should be knowing, because if you are going to go inside, then we need to have a very much, a greater idea as to how these, where we are getting these components from. So just to give you a very brief idea, this is how a muscle force is calculated. Now again, these are all these characteristics were obtained from the experimentation that Hill performed. So as you can see, the first graph talks about force length characteristics. Here what happens is, as soon as the cross bridging starts, you slowly see the value reaches 1. It's a normalized value, so it reaches the maximum force generation capacity of that particular muscle. And as soon as the sarcomeres, they slid past the actin myosin, not the sarcomere, but the actin myosin, they slide past each other, and they are going back in their original shape, the force generation slowly reduces. Now this is only for the active component. As you can see, passive. Now passive starts from once they have gone back to their original value. Now further extension of that segment is happening. Now because of that further segmentation, further elongation of that segment, that elastic energy is being created. So that is the force which is being generated by the passive element. That is why it starts after 1. 1 is the value, it has reached its peak, and now slowly when it is going back to its original shape, and then from the shape it is being stretched further, that is where the passive force is being generated. Now the other thing is force velocity. Now force velocity is when you are picking a dumbbell, you do it slowly, but when you are releasing the dumbbell, it happens fast. So that is why, as you can see in the eccentric contraction, the velocity is increasing. The top of the graph, you see, it represents the eccentric contraction. Eccentric is where the elongation is happening. So there the velocity increases, but as soon as you are shortening or you are making raising dumbbells or doing some kind of contraction, concentric contraction, then your velocity reduces. So these graphs were obtained from experimentation. Also, this is supported by logic as well. Now this is activation dynamics. Again, activation dynamic is when the neural excitation is getting converted into muscle activation. So it's a first order differential equation where the rate of change of activation is dependent on what is the change in the current uh, muscle activation depending on the neural excitation it is getting. So if the brain is sending signals and it is keeping on sending signals, so it is going to cross a threshold. It is going to say, okay, it was not a false alarm, but the brain is asking me to get activated. So it is not, it doesn't get excited in just one impulse. It is going to wait for a train of impulses to come from the nervous system, and then a threshold is crossed, and then the muscle starts getting activated. So that is why we see the rate of change of muscle activation. If there is only one impulse and for the rest of the time we are not getting any impulses, so the rate of muscle activation is not changing. If you are going to get a strain of neural impulses, that means the muscle activation level is going to change. The rate is changing, and that is how it is decided that the muscle is now going to get activated. And slowly, how it is going to get activated, it is going to it's not going to be an instantaneous activation, but it will slowly rise up. Even though the time taken to slowly rise and to reach that to cross that threshold, it's very small value, but still it is not going to be an impulse function, but it is going to be a slowly exponential increment, and then it is going to start the activation. Ka here is the time constant. So it also depends on how I mean, what is the time being required when the muscle is activated or deactivated. So it is all these all values were derived experimentally depending on, because the muscles were being sent those electrical impulses, the electrical impulses, because we use the functional electrical stimulation as well. So we are giving the electrical impulses, and then we are analyzing a standalone muscle and saying, okay, this is the time it is going to respond to the external electrical impulse. And that is how the time constants are decided when the muscle gets deactivated and activated. Contraction dynamics. So once the muscle is activated, now the activation does not mean it has started producing force. Now from neural excitation from the nervous system, it takes some time to generate muscle activation. Now from muscle activation, it takes some time to generate muscle force, because of that muscle force generation, you are able to move your hand, right, or move your limbs. So that contraction is dependent on this particular formula, which is being which is shown in equation 8. So it depends on FV. Here is the force velocity relationship which we saw earlier. Okay. And then FL is the force length relationship, which we saw earlier again. And the AT here is the activation value, which we got from the first order differential equation. And F naught M here is the maximum force generation capacity of that particular muscle. So for each muscle, we are going to have different set of force values for that particular point of time, depending on this equation number 8. Because each muscle is going to have its different FE, FL, even though the general pattern is going to be same, but the values are going to be different. Now, there are two types of modeling approaches. One is the inverse dynamics, the other one is forward dynamics. So the first, the which mentions is the forward dynamics. It is that we are going from force to motion. So the force is being produced inside of the body and it is resulting in motion. The other part is you're analyzing the motion, and then you are predicting what were the forces that caused the motion. So this way it is better because we cannot every time analyze what is happening internally invasively. So we most of the time we are capturing the motion and then we are inversely going back to the source that produced that motion. Now, OpenSim is one of the softwares out there which gives you the freedom to model and also perform such analysis to understand how your body or how the deep muscles or how basically your segments are interacting with each other. So, in order to get a good biomechanical analysis idea, you can use this software. It's a freely available biomechanical software, and it gives you a set of tools which you can use to analyze each activity in terms of muscle and joint outcomes to get a better idea as to how your body performs when it is undergoing different kinds of locomotion. It also has it also gives you the extensibility of running predictive simulations, so you can actually do what if scenarios. So what might so happen if I'm going to go perform this surgery, if I'm going to change the direction of the fiber length of this particular muscle, what is going to be the end result and the motion that is going to happen, what is going to be the impact, is it just going to impact that particular joint which the muscle is crossing, or is it going to have a cascading effect on the other joints as well. So those kind of studies you can perform. It has also the good thing about OpenSim, it gives you a large repository of models. So you, if you are unaware or if you are not sure where to start from, you can always take models that are there in the repository. You can start exploring them. You can start understanding how they're made, because the blue structures which you see, they are all wrapping surfaces. The soft tissues or the organs, so we do not model organs. What we do is we have a wrapping or a cylindrical surface which look more or less like the internal structure, and all we are concerned about is the bone geometry and how the muscles are wrapping, because your muscles are not straight lines, they are actually forming a curvature, right? So that curvature is made using these blue wrapping surfaces. Now again, OpenSim framework, it has but follows normal equations of motion. So equations of motion includes, as you can see, so the physical system, from the physical system we are going to go create a musculoskeletal system or computational musculoskeletal system, which is going to have the joint, the muscles. Now as you can see here, the muscles here, they are modeled as lines, red lines. Now one single muscle is not going to be represented by only one muscle, one line, red line. It is because our muscle, they have a volume, right? So only one line segment cannot demonstrate or represent that. It is going to have a series of line elements, red line elements, that is going to capture the entire muscle geometry. So that is why you're seeing so many lines. Okay, once we have modeled that, then we are going to go ahead and run the motion dynamics equation. So motion dynamics equation, it is going to give you acceleration, velocity. So it's deal with acceleration of your joints, velocities of your joint, and the position of your joints, right? Because if we are not concerned about the segment position, but the position of the joints. So if we know the position of the joints, we can actually understand why we are running the equation, the motion dynamics equation, Because in the end, what I'm interested in knowing how much is the torque being generated at this particular joint, so that for a person who's not healthy, for instance, who has lost this functionality, I can create a rehabilitation device because I know what amount of torque is required to move this joint. So all these analysis I'm doing in order to figure out what are the parameters of a normal healthy person, so that I can use these parameters as reference when I'm creating some kind of robotic or some kind of rehabilitation device for people who have lost some part of their body's functionality in terms of joint and muscle. This is the framework. I have already the red lines, the musculo-tendon actuators, because the red lines, they club the muscle and the tendon part. There is no demarcation for tendon, but it is incorporated in the same red segment. So even though the muscle and tendon both are different, because tendon is a passive structure, but here they are clubbed together. But they, while modeling, we actually have to consider the length of the muscle fiber and the length of the tendon differently, even though visually they are same. But in the equations, we actually assign them a definite value, saying if this is the length of the red line actuator that we have modeled, so this is the muscle fiber and the rest part is the tendon. And again, the graphs are the same force length and force velocity curves. The model here which you see is again the Hill muscle model, which has the contractile and passive elements. Now, the typical OpenSim workflow is we capture more data and then we scale the model. Like I said, it could be based on some other subject data, and now I want to perform analysis on another subject. So we are going to scale it to the anthropometric details of the subject in question. We are going to run inverse kinematics. Now, inverse kinematics, it's again what we are doing is we are converting that point, the marker points in space in trajectories. I'm interested because in markers you're only going to get positions of these two markers, right? But I want to understand the angle this joint is forming when I'm walking. So inverse kinematics is going to result, it's going to give a trajectory after for using the marker locations. And then from there, the inverse dynamic, because like I said, I'm more concerned about the torques that are being generated at the joint. So inverse dynamics is going to give me the forces or the torques that are being generated across all the joints that I've incorporated in my model. And then that torque, because it's an inverse dynamics approach, I'm moving from motion to forces. So I'm going to calculate the torque first, and then that torque is going to be used to calculate the individual muscle forces, the muscles that are involved in bringing about that motion. Joint contact forces can also be calculated. The joint contact forces are basically the bone on bone force. So if I'm concerned about the force which is being produced between the femur and the tibia, I'm going to run that contact force analysis. So this is just one of the many things that is being offered by OpenSim to actually analyze the invasive parameters that are very hard to capture, even though if you get ethical approval to perform invasive surgery, even then such parameters are very difficult to obtain. The green line, the green arrow which you just saw is the ground reaction force. So that is how when we are walking, the ground exerts a reaction force. And as we are walking, the magnitude and the direction of the ground reaction force that keeps changing. The ground plays a very, if we are walking on a stable ground, the reaction that the ground is producing also has a great involvement as to how our muscles are producing activation. Again, because we have to actually analyze the impact of the external force as well. So the ground reaction force is the external force. Including all the forces, they actually give you an idea. And also you see the change in the muscles, right? Initially they were red and initially they were blue. So blue means that they are not producing any kind of activation. And as they slowly turn into red, they are producing, they turn red depending on how they are activating. So redder means they are going to be activated more. Okay, so these are some of the applications of OpenSim. Like you can actually analyze if you have to develop an exoskeleton for the ankle joint. How is it going to be? How is going to be the design? if you are going to develop a passive actuator or if you are going to develop an active actuator, you can analyze all those techniques. You can simulate it in OpenSim, and using that, you can have justified outcomes that yes, this is the design I should be considering for this particular subject for exoskeletal, so that it gives the required support and it gives the required foot clearance so that the person in question is able to perform normal walking. Or if so, we actually have to consider if it is the exoskeletal is only going to be for normal locomotion activities and not rigorous activities like jumping or skipping. So even so, for those applications, the design is going to be different. It is going to have a foot plate which will have more sole, or it will have better shock absorbing spring maybe, because in order to reduce the impact. So that is how basically the need of the person is going to determine how the design is going to be made. But all these analysis we can run with OpenSim. Implant design. So whether in figure A you can see there's this the network that is created, and in B you can see the other sort of network is created. So out of the two, which network is going to give us better results? We can also analyze that, because the load distribution is going to happen in a way which is going to mirror the physiological accurate behavior of the muscles in question. So this uh, tendon, because the tendon in this case the tendon was fractured. So what happened now? They want to replace the tendon. So there should be some compatibility between the artificial tendon network and the existing muscle, right? So the pairing should happen in a way that it should mirror the original tendon muscle interaction. So which network is better? Is it the network which is shown in A figure, that is better, or B is better? So once the network was formed, the analysis was run. They asked the subject to grip a ball, hold it, and then they were actually seeing whether the outcomes that were being produced by this particular network, the artificial tendon network, whether it was solving the purpose, whether it was restoring the functionality of the hand or not. Now, last is predictive simulation. Now, so you see that the person is going to land on an inclined plane. Now, as you can see, it's a very risky setup, because the first thing which you will that is going to come to mind is obviously the ankle joint is going to get, it's going to get sprained because the weight is landed. But then we can perform analysis saying that what if we land at an angle, and what if we have the foot in a position that reduces the chances of sprain. So all these kind of studies can be performed in OpenSim. It's not just that it is going to give you an idea of a locomotion, how it is happening, but you can also do predictive what if studies, that how is going to be the load distribution if I have a body that is, given this in this particular scenario. So all those things you can do in OpenSim. So I thought of including other examples as well, but since this lecture was only for 1 hour, so I thought of giving you just a brief idea. Even though I think that most of the things must have been very because since this is something which needs a lot of time to understand and grasp. So I hope I was able to actually give you a brief idea as to how we model musculoskeletal models, computational musculoskeletal models, and how OpenSim plays a very important role in enabling us to do that. Thank you everyone for being such a wonderful audience. If you have any questions, please go ahead.
Thank you so much, ma'am.
Thank you, sir.
The stage is open for any queries. If any of the participants have any questions, you can ask. I'll encourage all the participants to please take interactive part in this question answer session. Okay. In that case, thank you so much, Dr. Giri, for your engaging and thought-provoking session. Your insights on innovation in healthcare engineering truly set the foundation for the discussions we aim to pursue this week. As a token of our respect and appreciation, I would kindly request Dr. Gaurav, the organizing secretary of this FDP program, to please present you with a virtual moment.
Thank
Dr.
you, sir.
Gaurav.
Thank you so much, sir, Saurav sir, for inviting me. Ma'am, we would like to request you kindly accept this e-memento
Thank you,
as
sir.
a
It's an honor.
gratitude
Thank you so
from the
much, sir.
organizing committee member. And
Thank you,
thank
sir.
you so much for accepting our invitation and
Sir,
conducting such a wonderful talk.
it
Uh,
was my pleasure. Thank you.
to participant, I have given you right to unmute yourself. You can ask your query.
Okay, so if any of the participant has question later, you can send us an email or query to Dr. Gaurav or to me, and I'll forward it to Dr. Giri. Thank you so much, ma'am, for your time.
Saurav sir, thank you, Saurav sir, for
Thank you.
inviting me for this wonderful talk session. Thank you. Thank you to all the participants for being such good listeners. Thank you. Have a good day to all.
You too, ma'am. Thank you.
Okay, sir.
Moving forward, I'm pleased to invite our next distinguished speaker, Dr. Poonam Shivram from Deenbandhu Choturam University of Science and Technology, Mutha. Dr. Poonam Shivram is an associate professor and chairperson in the Department of Biomedical Engineering at Deenbandhu Choturam University of Science and Technology, Murthal. She holds a PhD in electrical engineering and an MTech in instrumentation and control from TCRUST, along with a BTech in biomedical engineering from GJUSNT. With over 16 years of teaching experience, her research focuses on biomedical signal and image processing. She has authored numerous papers in international as well as national journals. Along with that, she also has numerous papers in conferences. She has guided several postdoctoral theses so far. She is an active life member of the Biomedical Engineering Society of India and the Institute of Engineers India. We are delighted to have her guide us through her topic, innovations in wearable and chronic sensors for healthcare applications. Ma'am, the floor is all yours.
Thank you, sir, for introducing me in front of all the audience. I feel privileged to be the part of this FDP on smart health innovations. And sorry, I am not able to. Uh,
Um, okay. Dr. Gaurav, can you please make her co-host? I think.
Sir, I have already made the co-host to ma'am.
Okay, ma'am, you can try to share the
Ma'am, you
slide.
can share your screen. You are
yes,
the
yes,
co-host.
yes, yes. I'm trying. Is it visible, sir?
Yes, ma'am, your screen is visible. You can share now.
Okay. So should I start now? Is it visible to all of you?
Ma'am,
Yeah,
your
ma'am,
PPT is
slides are
not
not.
visible.
Yeah, your PPT is not visible, but your screen is visible.
It is
So
not
we can.
visible.
You
No,
can,
Okay.
yes, you
Just
can click
just
on
give
the,
me.
yes, ma'am.
you can take it.
Hmm. Uh, I'm sharing it again.
Yes.
So somehow I'm not able to share my entire screen. Actually, I want to.
Yes, ma'am. Just click on the share and open your slide, ma'am.
Slide is opened, and when I click on entire screen, share
Yes.
option is disabled.
No, you can share, ma'am. And it will come, ma'am.
Entire screen. Okay, share.
Yes, ma'am.
Yes.
Now
Yes.
you just open
Now
your
my-
PPT.
Yeah,
Yes, ma'am.
it's working now.
Yes, ma'am.
Yeah. Ma'am, make
Okay,
it full
okay.
screen,
Thank you.
please.
Thank you for help.
Fine.
Oh. So today I'm going to talk on the topic. Sorry for the disturbance. So today the topic of my talk is innovations in wearable ionotronic sensors for healthcare applications. So wearable sensors are playing very important role in healthcare technologies, especially Internet of Medical Things. They are totally based on wearable sensors. So for taking care of old age patients, for remote monitoring of the health of our near and dear ones, wearable sensors play a very important role. And ionotronic sensors are gaining significant attention as wearable sensors because they have exceptionally good mechanical performance, and they are able to maintain electrical performance under various mechanical stimuli. Because you all know that wearable sensors, if we talk about wearable sensors, then wearable sensors should work in all the conditions when the patient is lying on the bed, or he or she is moving, or means the wearable sensor should be able to bear all kind of mechanical stimuli. So ionotropic sensors are playing their role, good role as wearable sensors. So ionotropic sensors, they can respond to stimuli like mechanical stimuli, humidity, temperature, and that's why they are coming as versatile sensors. So here, this presentation will showcase you the recent researches and developments on various types of ionotropic sensors like pressure sensors, strain sensors, humidity, temperature, and even multimodal sensors. Because they have robust performance, and we are going to talk about their constituent materials, their sensing principles, along with healthcare related applications. So with the invention of wearable sensors, you all know, there we noticed a revolutionary transformation in our public healthcare sector. These sensors, they have the ability to monitor a wide range of human signals, including body movements, complex body movements, physiological conditions, skin temperature, and humidity. So the data that we are getting from these signals, physiological signals, they are very important. They play a very important role in early disease diagnosis and health monitoring. Conventional wearable sensors, where they were lacking because they primarily rely on electronic conductors, and electronic conductors, you all know, they are either metals or semiconductors, and they are rigid materials. And wearable sensors should be flexible, they should not be rigid. So some efforts have been made to make those sensors flexible using different strategies like thin film deposition, patterning, conductive filler polymer composite, etc. But electronic pathways generally got damaged or worn down due to repeated and significant mechanical stresses, and ultimately or eventually lead to degradation or loss of electrical conductivity. So these all issues, they highlighted the need of robust wearable sensors that can withstand different type of mechanical stresses and perform well. So in this sector, ionotropic sensors have been invented, and they were worked upon, tested, and found that they are quite performing quite well as compared to conventional metal or semiconductor based sensors. So ionotronic sensors, they how they operate, what is the principle of ionotropic sensors? They operate by manipulating ions in an electrolyte. They utilize electrolyte is present throughout the internal sensor, and the ions from that electrolyte, they move under an electric field. So in the presence of electric field, mechanical motions are observed in ionotonic sensors, and vice versa. If mechanical stresses are being applied on ionotonic sensors, electrical conductivity is observed. So due to these characteristics, characteristics, ionotropic sensors becomes exceptionally resilient in terms of electrical performance under mechanical stresses. Why? Because the ion distribution throughout the of ionotonic cells is homogeneously distributed. Moreover, these ionotonic sensors, they are inherently soft. As I told earlier also that wearable sensors should be flexible. For flexibility, rigidity should not be there, so the material should be soft. So ionotonic sensors, they are inherently soft because they composed of polymer matrix like hydrogel, organogel, ionogel. Ionotonic sensors are also versatile in enhancing their mechanical properties. They themselves can enhance their mechanical properties. Which mechanical properties? Like high toughness, self-healing capabilities, strain stiffening behavior. How? By designing intermolecular interactions within the sensors. So these sensors, they have exceptional mechanical characteristics that make them fit for wearable sensor technologies. So they are capable of measuring various stimuli such as pressure, strain, humidity, temperature, etc. that are needed for a particular wearable sensor in healthcare applications if we talk about. So this is because the electrical property of the ionotropic sensors can change in response not only mechanical deformation but also to the external stimuli. Means if we apply mechanical stress on ionotonic sensor, electrical property is change in electrical property is observed. But in case of external stimuli also, similar change in electrical properties are also observed due to ion mobility or dissociation of the ions. So these diverse sensing mechanisms, they propelled ionotonic sensors into the realm of multimodal sensors. Means they can capable of measuring different stimuli. We can have a single sensor and we can measure different stimuli using that sensor. So it makes them promising candidate for a wide range of applications, from healthcare to environmental monitoring and beyond that. So, talking about the constituent materials of ionotonic sensors consist of ion transport layer and electrons. And they need to be soft like skin to function as wearable sensors, as I already told you. So, they should be capable of withstanding various physical stimuli like pressure, bending motions, stretching, and maintain stability in diverse environmental conditions. This is the preliminary prerequisite for acting as an ionotonic sensor as a wearable sensor. So, talking about the first constituent, ion transport layer. It is a critical component of ionotonic sensors. This ion transport layer, it allows them to detect external stimuli. How? By altering electrical properties. Which electrical properties? Like resistance, capacitance, impedance, in response to the mechanical deformation. Like if we stretch it, if we bend it, or if a wearable sensor is getting stretched or bent with respect to the movement of the patient, the changes in electrical properties of the sensor are observed. So this layer is composed of polymers. Polymers is for structural support and ions for conductivity. So various stimuli can cause the ITL to deform or change. Internal temperature and humidity, resulting variation of the ion conductivity, and eventually it enables the detection of external stimuli. So ITLs can be categorized into different types, and the categorization is totally based upon ion transport methods within the polymer matrix. So based on that, the types of ITLs are solvent-based ITLs, ionic liquid-based ITLs, and liquid-free ITLs. Solvent-based ITLs. As the name of this particular type, solvent-based ITLs, here we use polar solvents. And polar solvents are used to dissociate ions and create mobile ions within the layer. Polar solvents that we are talking about, for that we can use water-based hydrogels. These water-based hydrogels are the polymer matrices with over 90% water content. So these have been a significant focus in the development of ionotronics. Hydrogels, water-based hydrogels, they are playing very important role in the design of solvent-based ideals. So this is due to their low Young's modulus, which is similar to the skin, high ionic conductivity and excellent biocompatibility. Means these solvent-based ideals, they are working similar to the skin due to their low Young's modulus and high ion conductivity and excellent biocompatibility. Some researchers, they developed highly stretchable and tough elastomeric hydrogels. How? By utilizing strong covalent bonds between polyacrylamide polymers and weak ionic bonds between alginate chains and calcium ions. However, hydrogels are have inherent limitations, like they have high vapor pressures, and these high vapor pressures, they can lead to unavoidable evaporation issues and high melting temperature. And due to these issues, their usable temperature range got restricted. So these limitations, some researchers worked upon overcoming these fundamental limitations, and by developing organo hydrogels, by adding organic solvents like ethylene glycol, dimethyl sulfoxide, glycerol, which have polar groups such as hydroxyl groups, to avoid this high vapor pressure problem. Solvent-based ITL, they present versatile platform for sensor designing. They offer broad spectrum tunable characteristics through a variety of selection of solvents. Means here we can use different kinds of solvents, salts and polymer components. And by using the combination of all these, we can design a different kind of solvent-based ideas with a broad spectrum of tunable characteristics. So this adaptability, it facilitates the creation of sensors with tailored properties to meet specific requirements. Means we can select a kind of solvent that we want. We can have a choice of the salts and polymer components, and these these choice of freedom, that facilitates for the creation of sensors for customized properties. Means whatever specific requirement is there, we can design a kind of sensor according to the requirement. Also, manipulating the composition of polymer matrix, here we can change the composition of polymer matrix also, particularly the type and quantity of the solvents. So it provides a facile means for adjusting the TG. The TG is the glass transition temperature. Means हम polymer matrix की properties को भी manipulate कर सकते हैं इसकी composition को alter करके. So in turn, oh sorry. So in turn, it allows for the fine tuning of mechanical properties like Young's modulus. Means we have a variety of options, like we can choose a different kind of polymer matrix. We can change the composition of the polymer matrix, and eventually we can adjust the properties like glass transition temperature and Young's modulus. So similarly, like the composition of polymer matrix, we can change the we can we can control the quantity of salts also in the system, and it offers trade methods for tuning electrical properties. Like if we are altering or we are controlling the mechanical property of this particular ITL, we can also regulate the electrical property of this ITL. How? By controlling the quantity of salts. So polymer is used for mechanical properties, and salts can be used for altering the electrical properties. So notable conductivity of solvent ITL facilitates substantial signal variation, making the sensor consisting of solvent-based ITL amenable to measurement using miniaturized instruments. So this particular property, it showcases their potential for deployment in wearable sensor technologies. So adaptability and tunability of wearable sensors with solvent-based ITL, they position them as promising candidate for diverse applications. ITLs ionic-based ITL. Earlier solvent-based, here we are about ionic liquid ITLs. Ionic liquid-based ITLs, they consist of polymer matrix and ionic liquid. And they inhaling the liquid. Means the property of L is related to the property appearance that we are use. So we can call it ionogens. So ionic liquids are composed of large organic cations and anions, formation of regular crystal lattices, due to which it results in ionic emissions, causing low melting temperatures and enabling IL-based ITL to work at very low temperatures. These ionic liquids, they themselves have very strong electrostatic interactions between their ions. So we require a significant amount of energy to break these interactions. And it allows the individual ions to escape into the vapor phase, resulting in lower vapor pressures of the ionic liquids and allowing IL-based ITLs to operate long-term with rare solvent evaporations. So, IL-based ITLs not only possess notable electrochemical stability, but also encompasses a wide operational potential spectrum. IL-based ITLs, they allow the design of mechanical and electrical properties through intermolecular interaction between IL and the functional groups of the polymer matrix. Means we are using polymer matrix along with ionic liquid. The intermolecular interaction between ionic liquid and the functional groups of the polymer matrix, they allow for the design of mechanical and electrical properties of this IL-based ITS. So ionic-based ITS, they are actively researched as wearable sensors applications because they have high ion conductivity, high environmental and electrochemical stability. Their high conductivity and broad electrochemical window, they allow ITS to withstand high potentials without electrolysis. So they are resilient to higher voltages. And this poses advantage for generating measurable currents using miniaturized instruments. Moreover, they have high thermal stability and the higher electrochemical stability of ITL, they enhances their durability and reliability as wearable sensors in diverse environmental conditions. So these IL-based ITLs, they are also posed as a promising candidate for sensor development in healthcare applications where there is a requirement of robust performance and adaptability according to the diverse environmental conditions. Third type of ITL is liquid-free ITL. So there are problems with liquid-based ITLs. Some problems are that the problem of evaporation of the liquid and leakage of the liquid. That's why third type of ITL was invented. It is liquid-free ITL. So in liquid-based ITL, liquid-rich component can be lost through evaporation, as well as severe mechanical deformation such as shrinkage. So researchers aim to develop liquid-free ITL by imparting ionic conductivity characteristics to elastomers. So they are fundamentally solving the problem of liquid loss and enhancing the the environmental stability. First, liquid-free ITL could be approached by dissolving salt in the polymer. It is also called as salt in polymer. Liquid-free ITLs, they can be manufactured based on thermally and electrochemically stable organic salts or ionic liquids. Endoine sensors produced from liquid-free ITLs with exceptional thermal and electrochemical stabilities. Due to the absence of liquid state, with these liquid-free ITLs, we can eliminate the risk of liquid leakage as well. And they can perform well, very well, with substantial or repeated mechanical stimuli as compared to other two types of ITLs. Now, as we discussed that ionotronic sensors, they are comprised of two major constituents, that is ITL and electrodes. So coming to the electrodes, what are the different kinds of electrodes that we can use, and what are the properties of those electrodes that make them useful in wearable sensor technologies. So electrodes, as the skin interface electrodes have emerged for healthcare monitoring, there is a demand for flexible and stretchable electrode. If we are talking about wearable sensors, then flexibility and stretchability is the primary requirement for electrodes as well. Means they can be operated on the curved or stretched skin. So researchers have focused on developing flexible and stretchable electrodes. How? By bending conductive materials like carbon nanomaterials or metal nanomaterials with flexible and stretchable polymers. They blended conductive materials with stretchable polymers. Conductive polymers like polyaniline and polystyrene sulfonate have also been used for this purpose. However, ionotronic sensors measure differences in ionic conductivity based on external stimuli, which can be affected by electrode resistance. So, the conductivity of the electrode is very important in the measurement of the particular stimuli. Conductance should be maintained under different mechanical deformations. So it is essential to develop both highly conductive and strain sensitive electrode. We have two major requirements for the design of an electrode, that is high conductivity and high strain insensitivity. For that, different designs of the electrodes have been proposed by the researchers over the time. So electrodes with multi-layered conductive layers. So conductances decreases in mechanical deformation. As you know that whenever there will be any mechanical stimuli operated on a particular sensor, the conductance will be decreased. Why? Due to the breakage in the conductive pathways. So here, to avoid this, electrodes are invented with multi-layered conductive layers to avoid that failure in the conductive pathways. So researchers have developed these kind of multi-layered conductive fillers to create sufficient conductive pathways. Means if one or two pathway is broken, then complete breakage of the conductive pathway can be avoided. Some pathways can also survive. So some researchers like Moon et al. Created a multi-layered gold nanosheet based electrode through several transfers of floated gold nanosheets on a water surface onto substrates. It exhibited very good performance and resulted in an electrode that showcased a conductance change of less than 2 times even at 100% strain. If we use more conductive fillers to make the electrode more strain insensitive, we can experience a disadvantage of reduced flexibility and increased Young's modulus of the electrode. It lead it to the mechanical mismatches with the skin and ionic gel. So these are the disadvantages, and for that, further researches have been carried out by the researchers, and electrodes with wavy structured conductive layer have invented. So this is because it is only to prevent the failure of the conductive layers with low toughness. Some studies have developed strain insensitive electrodes with a serpentine pattern or wavy structures to make the conductive pathway. Means our requirement is to maintain conductive pathway and to avoid the sensor to become more rigid. Means we need to have low Young's modulus of the sensor, high conductivity with good conductive pathways. For that, these serpentine patterns and wavy structures have been introduced. These patterns help maintain the conductive pathway, minimize changes in the conductance. Uh, Zhang et al. Produced an electrode by embedding a serpentine structured gold within a polydimethyl silicyoxane matrix. So this is one attempt by Zhang et al. They produced an electrode with wavy structured conductive layers. So they optimized the height and width of gold conductive line. Why? To calculate the maximum strain on the gold based on external strain and finding the most strain insensitive electrode. However, these wavy structures are created through pre-stretching in one direction, making them insensitive to strain only in that direction. For practical applications, the electrodes need to be insensitive to strain in all directions, not in one particular direction. Then electrodes with fixed conductive pathway. So we have gone through the electrodes with serpentine and wavy structures. They have the property of strain insensitivity, but only in one direction. So we can see that there is a failure of isotropic 2D nanosheet under external strain. So 1D nanowires, they are anisotropic, which aligns along the strain direction before failure occurs. So they can align in the direction of the strain, not in one particular direction, in any direction. So if the interconnection between nanowires is maintained, the conductive pathways remains relatively stable with the alignment of nanowires. So it results in minimal change in conductivity. However, the strange range where nanowires only undergo alignment is relatively narrow. It is typically less than 100%. Beyond that point, failure occurs and conductance rapidly increases. This issue is also addressed by some of the researchers by using intrinsically stretchable materials. So, for that, electrodes with soft conductive materials have been invented. So, conductive polymers have been employed to create soft electrodes with their electrical conductivity and mechanical properties. These conductive polymers, they exhibit higher toughness compared to metals or carbon nanomaterials, making them resistant to the failure to external strain. However, these polymers, they are embedded within a conductive hydrogel, means uh, they are equally tough as metals and carbon nanoparticles and soft as well by using conductive hydrogels. We mix these conductive hydrogels, polymers with the hydrogels. This simple mixing can undergo reorientation, leading to the changes in the conductive pathways. So this reorientation, which leads to changes in the conductive pathway, it can be addressed by using densely packed polyethylene deoxythiophene and polystyrene sulfonate pathways within this P.PSS hydrogel. Now, so far we have talked about ionotonic sensors, their significance, their constituent materials like electrodes and ITL. Now, coming to the application of ionotonic sensors, what label for different applications in the healthcare. So, one of them is ionotonic pressure sensor. So, this IPS, the principle of IPS is it adopts a sandwich configuration consisting of two electrodes separated by an ITL. We have two electrodes and a ITL layer is sandwiched between two electrodes. When the voltage is applied on the electrode, charge electrode attract counter ions and repel coions, and it results in the formation of electrical double layer at the electrode electrolyte interface. And this electrical double layer is of the thickness of around 1 nanometer. So the absence of charge transfer reaction in this process, it causes charge to be stored over this thin layer, and it gives rise to the huge capacitance called as EDL capacitance. It is about 100 times larger than that of the traditional solid dielectric method. This EDL capacitance, it is proportional to the contact area between the electrode and the ITL. So external pressure induced deformation, it leads to the alteration in the contact area between ITL and the electrode and causing large variations in the EDL capacitances. So it makes the IPS portable and wearable because their high capacitance is measurable through small size of impedance analyzers without electromagnetic shielding. So based on these improved sensing capabilities, IPS have advanced beyond slow and large motions, such as locomotion, expanding its application to various real life and healthcare scenarios. So IPS have been used some researchers, they introduced some changes in IPS structures, like they presented a gradient micropyramidal surfaces, IPS with gradient micropyramidal surfaces that can recognize tiny pressures even under high pressure conditions, surpassing the commercial weight scales. So these outstanding capabilities to determine the fine pressures, they enables the monitoring of subtle pulse waves originating from the fingertip itself. So it can not only measure heart rate, but it can also recognize various components of the pulse waves, including percussion, tidal waves, and dichrotic waves. However, the skin secretions like sweat and lipid, they can hinder their performance. So these issues are also addressed, and some researchers, they introduced the silk nanofibrous IPS to facilitate the evaporation of the sweat. Then ionotonic strain sensors, they have vital applications in body motions, like tracking body motions in healthcare, rehabilitation, athletic performance evaluation. They need to be adhered closely to the skin. They should be flexible and be adept at capturing wide range of dynamic movements. Moreover, they should withstand repeated mechanical stresses to ensure continuous monitoring. So, ionotonic materials, they are distinguished by their exceptional mechanical pliability. We have discussed it at length, featuring significant stretchability, fatigue resistance. These characteristics, they helped it to position it as a potential wearable sensor technology, and moreover they have self-healing properties as well. So their consistent ion connectivity, they guaranteed continuous current flow even in a high stress environment for ongoing measuring the ongoing changes in the strain. So, what are the applications of ISS in particularly in healthcare? ISS, they with improved sensing performances, they can be applicable to monitor not only large and slow mechanical deformities such as knee bending, locomotion, but they can also be used for small and fast mechanical deformations like vocal vibrations and wrist pulse waves. Jang et al. Prepared an ISS by incorporating potassium and sodium ions into a carboxyethyl chitin or PAM hydrogen. So these hydrogens, they achieved a very good performance and demonstrated good relaxation times, enabling good detection of the strain. So these sensing capabilities, these sensors could monitor pulse waveforms on the wrist, distinguishing percussion peaks, tidal peaks, diastolic peaks. When placed on neck, these can monitor the movement of the throat and epidermis and identify specific and repeated signal patterns associated with voice, with special words. So thereby they are demonstrating its potential for phonetic recognition as well. Then ionotonic humidity sensor, IHS. IHS are utilizing hydrophilic polymer matrices, and they operate a formed hydrogen bonding with water molecule and hydrophilic functional group with hydroxyl and carboxyl groups. The level of water absorption in IHS, it change based on the external humidity conditions. These water molecules, they cause dissociation of electrolytes such as sodium chloride, potassium hydroxide, which increases the ion concentration. And these water molecules, they can also lead to the unfolding of polymer chains, reduces resistance to ionic movements, and enhanced ionic conductivity. IHS have wide applicability in healthcare applications, and the major application is to monitor the human respiration, because the air that we breathe in and out, it contains some moisture, and IHS measures the level of humidity in our air. So some researchers developed IHS capable of diagnosing SARS by assessing the intensity, frequency, and rhythm of the respiration. This IHS, they can be crafted from an ionic gel. It comprises of silk fiber and polymer matrix, graphene oxide to enhance hydrophilicity, and lithium bromide electrolytes. It can accurately monitor the rapid respiratory rates up to 60 breaths per minute. It has a good response time of approximately 1 second, and it facilitates clear distinction between SARS and the normal breathing patterns. So in respiratory monitoring, it is also possible to distinguish normal and abnormal respiration based on frequency and sensitivity of the sensor. For accurate monitoring of the intensity and rhythm of the fast respiration with tens of hertz using humidity ionic sensors that has a response time in order of seconds it is limited. Due to this limitation arises due to the long diffusion length caused by absorption of bulk structure. So this lower response time, to achieve this lower response time, is a challenge. Ionic temperature sensor. Ionic temperature sensors are also widely used in healthcare technologies, healthcare applications. Gel type ITS, they detect changes in ionic conductivity. They reflect ion mobility. Mobility shifts within the solvent due to temperature fluctuations. As temperature rises, metal cations attached to the polymer matrix through electrostatic interactions often transition to free ions. These free ions mobility is influenced by electromigration due to the external electric field, and their diffusivity depends on the temperature. So some researchers, they designed an organohydrogel ITS using a PVA polymer matrix and uh, AlCl3 electrolyte. It performed very well. It showcased remarkable mechanical attributes, enduring up to 480% ultimate tensile strength and tensile strain, and exhibiting a toughness of this much, 937.403 kilojoule per meter cube. Now, the applications of ITS. ITS are widely being used in healthcare applications. So they can detect human body temperature change with very good sensitivity and response rate. They can detect human fever using PA and cellulose nanocrystal polymer matrix based ITS. They confirm temperature changes from 36.1 degrees Celsius to 39.5 degrees Celsius, simulating artificial fever on skin with a 16% current change. Highly sensitive ITS can also use to detect the finger touch with elevated temperatures at the room temperature. So, sorry. Accurately detecting core body temperature via skin readings can be a problem, as skin temperature is significantly affected by external conditions. So, thus, strategies to insulate these sensors from environmental heat is very necessary and still a challenge. Now, innovative solutions to the existing challenges are real-time monitoring, flexible design, cost-effective solutions, wireless connectivity, environmental resilience, and user-friendly interfaces. We discussed about ionotronic sensors in detail. What are the different constituent materials of the ionotronic sensors? What are the variety of constituent materials, like different kind of ITLs, kind of electrodes that are being used in ionotronic sensors for enhancing their properties, for making them more promising for the wearable sensor technologies. Some challenges are there, like real-time monitoring, because if we are using wearable sensor technology in Internet of Medical Things, the foremost challenge is the real-time monitoring. Then flexible design. Flexibility is very important for wearable sensor technology. Then cost-effective solution is the very important criteria, that the solution we are providing should not be very costly. Environmental resilience should be robust. Wireless connectivity, user-friendly interfaces. These are the various issues that need to be taken care, and different researches are going on to tackle these issues. So this is all about ionotronic sensors that I want to tell you all. Different applications of ionotronic sensors, especially in healthcare applications. So
Thank you so much, ma'am.
this particular topic is a potential, it is a potential topic for further research. Any buddy who is interested in biomaterials, he or she can work on this ionotonic sensors and make them more useful for wearable sensor technologies.
Thank you so much, ma'am.
Any
If there is any question, you can ask participants.
questions?
You can unmute yourself and ask question.
I will share the content of the presentation with the participants, and if anyone wants to ask any question on later stage also, I welcome all the questions. I will try to address all the queries of the participants.
That will be great, ma'am. Thank you. Okay, so in that case, I guess we can move ahead. So thank you so much, Dr. Poonam Shiran, for your insightful and highly informative talk. Your deep expertise in wearable sensors for healthcare applications truly enriched our understanding. We now take a moment to offer you a virtual memento as a symbol of our gratitude. I once again ask Dr. Gaurav, if he is present, to please present you a virtual memento. Dr. Gaurav, are you there? Dr. Vignesh, are you there?
Hi,
So,
sir.
as Dr.
Sir,
Gaurav is not
please.
present right now,
Okay, sir. Okay, sir.
can I request Dr. Yognesh to please
So you have the
go ahead?
document.
Yeah, just a second.
Please.
So, Dr. Yognesh,
Sir, it is not visible.
it's not visible?
Now it is visible. Move
Okay.
on to ma'am's name. Ma'am's.
Yeah.
Here. Thank you, Saurav sir, for inviting me. Ma'am, please accept a token of our gratitude for your time and support.
Thank you so much
Uh,
for felicitating me and for providing me this opportunity to share my information that I have with wide audience that you have in your FTP. Thank you so much.
Thank you, ma'am.
Thank you. Thank you, ma'am. Thank you once again. Thanks so much. Moving forward, I am pleased to invite our next distinguished speaker, Dr. Munendra Singh from NIT Jamshedpur. Dr. Munendra Singh, just a second.
Oh, hello.
Hello, Dr. Gaurav.
Yes, sir. Yes, sir.
Okay, so can you please share the transit slide for Dr. Munendra Singh?
Yes, sir.
And please make him co-host as well. And please.
Munen sir has not joined yet.
He is.
Sir, he is joining actually. There is some issue with the internet. So he will be anytime soon.
Okay, we can wait for him to join.
Hmm.
So participants, our next guest is having some technical issue in joining. So please bear with us for next few minutes and he will be joining soon.
Muninder sir has joined the scenes.
Yes, sir. I have made him the co-host.
So we can go ahead with its introduction. Saurav sir?
Can you hear me now, sir?
Yes,
Dr.
sir.
Yuvnesh?
Yes,
Yes,
yes.
sir. Yes, sir. You
Okay.
please.
Okay. Okay. Moving forward, I am pleased to invite our next distinguished speaker, Dr. Munin Singh from NIT Jamshedpur. Dr. Munin Singh is an assistant professor in the Department of Electronics and Communication Engineering at the National Institute of Technology, Jamshedpur. He received his postdoctoral research training at the MR Research Division, Johns Hopkins University, USA, between 2021 to 2024. Prior to that, he served as an assistant professor at Manipal Institute of Technology, focusing on deep learning and image processing. Dr. Singh's research centers on developing physics-informed deep learning models for quantitative MRI. He also earned his PhD in 2019 from IIT BHU Banaras. We are delighted to have him guide us through his topic, Deep Learning Fundamentals for Medical Imaging. Dr. Singh, we welcome you and the floor is all yours.
Thank you, Dr. Saurav, for a nice introduction.
Thank you.
So, yeah, let me share my screen and then we can start talking about.
Yeah, sure.
Okay,
Sure,
I,
sir. You can take your time.
yeah, sure. So now I think you are able to see my screen, right?
Yes, yes, yes. Make it
Okay.
presentation.
Yeah.
Perfect. Yes.
So, what happened? Yeah. So, nowadays, I have seen in several workshops, talks, conferences, people. So very nice deep learning architecture, very good applications, right? They are very important because we get to update about what's going on nowadays in this particular area that is very, very blooming. And to some extent, it is getting matured. But today's talk is not on the showing very, very fancy networks, very fancy applications. But I would like to talk about some fundamentals, some introduction part of that, because people often miss those things because they do some a lot of new researchers, those just are in their they're just starting that field and then they do some application on that and but people start asking more depth about how this algorithm is working, what's happening behind that. So they find themselves difficult to answer. So for that kind of people, this talk probably will be very vital for them. I guess they will also get some, but their understanding will be improved, hopefully. So let's start. The today's topic is introduction to deep learning. Of course, we can discuss some application into the medical imaging. So here is the content of the talk.
Munen sir, your
Very
voice is lagging, so you can switch
first,
off your camera. That's why, yeah, participant can listen your voice.
I
Okay, sir.
will discuss as usual. Probably you will not have a voice lagging. So I will start from the what is the difference between the machine learning and why deep learning is important and why deep learning is more popular nowadays.
Excuse me,
Munen
Munin
sir,
sir. Your
Yeah.
your
yes.
slides are not visible. Please share it again.
Okay. window, some particular window I can share. Maybe, okay, this. You can now can you can you see?
No, I think so. There is some internet connectivity issue because it is showing. Yes, there is a lag, I guess. Now we can see your slides.
Okay. Okay. Now I can see my slides. Means
Yes,
when
yes, sir.
I am doing full screen. Okay. Maybe
Yeah, we
the
can see your
internet might be.
slides. You can
Okay.
start now. Yes.
Okay, so so I was means briefing about that to whom this talk maybe important and who can learn from this talk. So those who just started their field and has done something specifically some they are working on some application, they need to understand the fundamentals. So yeah. So very first, what I will talk about the machine learning and how machine learning is different from the deep learning. Many people already know, but this is just one slide I wanted to keep it here to just a beginning. Next is deep learning basics. For that, I will take a simple example, and then I will define a neural network architecture, defining loss function, optimizing the loss function. So there are some mathematics is involved, but yeah, but I will try to explain some mathematics to you. But I'm not means maybe you may not understand, but still you will have some rough idea how networks works. Then different design choices. How can you optimize your neural network? And ultimately, I will discuss about the physics-informed neural network, which is very new field, particular in deep learning domain. Let's start. So very first, what are the key ingredient of deep learning success? Why deep learning is so popular nowadays? Because we have algorithms. We can propose we are proposing nowadays very fancy algorithm, a very complex algorithm we are proposing nowadays. Of course, they are they are key behind the success of the deep learning, right? Uh, Before, people were not able to design these algorithms because of they are having limited data set. Because if your network is very complex, so it requires a huge amount of data set to train it. Now we have a lot of data sets. Everything is being digitalized, right? So we can develop a very fancy algorithm, very complex algorithm, since it is supported by the data. But most important thing is computing. Now we have computation power. So if you think about till 2000, right, till 1999, GPU were not popular. People are, I mean, NVIDIA is trying to build a GPU, so people were work on the CPU. So in what is the key difference between CPU and GPU? In GPU, you can have 1,000 of parallel cores, but in CPU you can have only, let's say, 8 cores, 16 core, like that. So here you have a small code per 1,000, but in CPU you have very powerful cores. That is not required for deep learning. For deep learning, a lot of cores are required. So the GPUs provide that power. So since 1999 or 2000, so GPU came into the effect and deep learning became so popular, and people start working on that, right? So now I will discuss what is the machine learning and how it is different from the deep learning. So in machine learning, what we can have on input. Then from the input, we have to extract features. To extract some features from the input, this is very subject specific. If you know about something, right, then only you can extract the feature. Let's assume you have a signal, and from signal you want to extract some feature. That means you have to understand that signal, because otherwise you will not never know that what is a good feature to extract that can give a very good quality output, right? So you need to have expert of that domain so that you can extract the feature, and then you can have a machine learning model and like SVM or something, and then you can have output, right? So this is conventional machine learning framework. Here I took an example. Here this is the X-ray image. So from X-ray image, so of course, a radiologist can tell you, or if your image processing domain, you can tell that, okay, histogram can be a useful feature, or color can be a useful feature for that, or texture can be the useful feature. And then you can use machine learning model and you can get the output. So this is a conventional machine learning framework, right? So how it is different from the deep learning? In deep learning, that model itself extract the feature. So everyone knows that model extract the features for you, and that's why you need not to be expert of the field, right? And this is another problem in that particular domain. The people are not expert from that domain, and still they are but it's good because that's why deep learning is so popular, and a lot of development has happened in the previous 10 years or more than that. Right. So what deep learning, it knows feature better than you or better than any expert. Now, yeah, that I have discussed, deep learning learns what are the useful and better for you, because it has lot of connecting weights and bias that we will discuss. So the next question arises: how deep learning model perform feature extraction, right? Because this is what it is doing over the conventional machine learning approach. So here you have an input and here you have an output. So in between input and output, you have lots of nodes. They are called neurons, and they are connected to each other, right? And if you see means this image, and when this image is getting multiplied with the weights and bias here, some numbers here, some random numbers here. For now, you assume some random numbers, and because of multiplication with some random numbers, you get some another image. And this kind of image is having a features that is a low, we call low level features. Mostly you have here edges, boundaries, or maybe corners. These kind of features you can have here. And when you further multiply by some random numbers, then you can have mid-level features and you start getting some contours, right? Some more clear boundaries or some partial objects. And if you further multiply with this, with some random numbers, so actually right now I'm saying random numbers, but the random numbers is only initially, but slowly these random numbers start making sense. And then you start having the high level features, the whole concept of this input image. That is called the sorry, this is called abstract information. So here you have a whole abstract information. So this is the whole information you have here in the compressed way. This is how deep learning extract the features from the model itself. So you see that they are the features. If I ask you to extract the features from some image processing domain expert, what he will do? He will simply uh, try to get the image edges, boundaries, all textures from this image, right? So this is what exactly deep learning is doing. Now I would like to take a simple example and we'll tell you how deep learning learns. So here we'll start understanding the basics. Maybe this could be a very boring for you, but if you pay a bit attention, maybe this could be helpful for you in some interview or somewhere. So to make it very simple, I will take a regression problem. In regression problem, I will take an input. So that input is here we have n dimension means n dimension input. Here we have, it can have a means 1 2 3 maybe a data points, you can say in a simple way, in a signal. And if you have image, it can have all number of pixels, could be the input vector for you. Okay, to make a simple. And a model prediction is output, that is prediction, that is a y prime, okay, y hat we call. Now this is the input and output. Now we are taking very simple example, since if you understand the medical image processing, so you can take example that if there is one image, from that image you have to find out whether, let's say the MRI image, so if this is diseased or this is healthy person. Okay, but yeah, so but here I took one example that is also very popular example. Everyone use the electric vehicle, and in electric vehicle, uh, based on the sensor data and environmental data, you have to predict how much far your car will go. So what could be the features? Features could be battery charging level, speed, tire pressure, and the output is driving range. You can have your example. It is okay. Just like I discussed that you have MRI image. In MRI image, you can have some features like in some features maybe the T1 weighted, T2 weighted images, and output is if it is the patient or healthy subject. Okay, so the ultimate what I want to say is here you have for make a simple model, you have a 3-dimension input. So 3-dimension input has 3 points, and you have output 1, and based on that you have to estimate something. Estimation means you have this is the simple estimation model. So estimate something in values called regression, right? So this is the regression model. So here you see this is the x1, x2, and x3. And if you want, you have a lot of inputs, you can, of course, keep increasing this. And all the inputs are connected to the output with some weights, means weights how much important this input is. Because all inputs may not be important to get an output, right? So W1, W2, W3 are the weights, and output is the y hat. Now, to get this output, we have to multiply this weight with the input. So here you see this is weight multiplied by input plus weight multiplied by another weight multiplied by another input. And here we have bias term to make a constant shift. And all the weights multiplication by the inputs can be represented by the W transpose, because we have a column here, and this is multiplied by the X, what is the input, and plus B. So when people ask you what are the network parameters, so you should say network parameter are the layer, weight, and bias. Weights and bias are the neural network parameters. So here you have weight and here you have bias, right? So these are the network parameter, and your whole job is to find out best network parameters to get some output, to get some meaningful output. Okay. So since I know that this is a shallow network, but of course we will extend it for a deep neural network. That is my topic for today's talk. And this is a very simple regression model, but we will see some other cases as well in this talk. Now first thing we already understood is what is the neural network, what is the network parameters, right? And what we have to do, we have to find the best parameters to get an output, right? Because if you have y and this y prime is very far from the y, so that's a meaningless. That's why you have to, but the x1, x2, x3 are already fixed. What you can make change, w1, w2, w3, b. So all these values you have to get the optimized value. So you will see how we can get it. So what is the loss function? Loss function are a measure of how satisfactory your model's predictions are, right? So here we have for this case, because this is a case of predicting some values, so the mean square error can be a very good loss function for us. And this is the actual output. This is ground truth by, and this is a predicted output, right? So this is the difference between these two is nothing but the loss, and somehow we have to minimize this loss, right? So how we can minimize it. So of course, as I said that, so you have to find out best by hat value to how you can find out W1, W2, W3, and B by changing these values. And the question is how we can change these values. Okay, that we will discuss. So this is a MSE loss over set of examples. So this is only one example here we have. If you have different examples, you can have different example means you have a lot of data set. So for all data set, you can have this loss function. Same, you do not pay much attention for that loss function. Okay. The next thing is how we can change the value of W and B. This is the major goal of the deep neural network or neural network. So okay, so what we are trying to learn, we should learn the optimizing the loss function. Optimize loss function means we are trying to minimize the loss function using some algorithm, optimization algorithm. This optimization algorithm is gradient descent algorithm. This is simplest one, though people are using the stochastic gradient descent, Adam optimization. So many algorithms are there for the optimization to find out the best values of model parameter. What are the model parameter? Again, I am reiterating again and again so that you should understand something that model parameter W and B, and how we can optimize using gradient descent algorithm. Optimization means we have to find the best parameter to get the minimum value of the loss function. So why it is so difficult? Because this loss function you see here, we have only two parameters, right? Two network parameters, W1 and W2 we have to vary. These two parameters we have to vary, right? To get the minimum value of the loss function. So somewhere here we have minimum values of loss function. For that, this algorithm has to know those values, W1 and W2 value. Let's say the W1, W2 value is 0.1 and 0.2. Okay, but it has to understand where is 0.1 and 0.2. So they start from somewhere, and slowly it has to find out some minimum value. And now the question is how it can find out the minimum value. What's the meaning of slowly, right? And you should understand that it looks very complex, but if you think about here we have only two parameters, but in actual network you cannot have two parameters. You have millions of parameters, so you have millions of dimension. This is only two dimension curve, right? If you have 1 million dimension curve, how complex it would be, you cannot imagine how to visualize it, right? So that's why it's very difficult job, and this is the most fundamental thing in the deep learning. So how we can do that? We can iteratively update the model parameter. In every epoch, we change something, then again calculate the error or loss, and then again we adjust those values and keep doing it. But we have to every time we have to find out the slope. Means slope is decreasing or not. Means if you have some point over here, so then you have to find out the slope. Point means if you have some model parameter value, then you have to find the slope there. Then again somewhere. Then if it is keep decreasing, then you have to keep going in that direction. If it is not decreasing, shouldn't go in that direction. This is the whole idea of gradient descent algorithm. Right? Now, to start from the very beginning, we will discuss the derivative and the gradient. What is the difference between the derivative and the gradient? Derivative means if you are just doing the differentiation for the one dimension signal, that's the derivative. If you have a multiple dimension, just like x1, x2, x3, then you have to take the gradient. That's why we call gradient descent algorithm gradient. We always use a gradient in the neural network because we have so many dimensions. Okay, so this is the derivative. And now this is the gradient. Here we have two variables, right? And in this gradient, we have to, rather than reaching the minimum, using the derivative, we have to take a gradient for the multi-dimensional signal. And here we have vector, right? This is just a differentiation. Now the gradient, what is the gradient descent algorithm? The negative of the gradient is the direction of the steepest descent. And this is the actual the direction where we wanted to move into the loss function. Okay, so we have to take a gradient. So the loss function was L, right? If you remember, and we have to change this L value with respect to the all model parameters, and model parameters were W1, W2, and B. And here we are assuming B is nothing but the W0, its value is 1. Okay, so here we see this whole or gradient of the loss function. We have to take a derivative with respect to the all model parameters. Then only we will able to reach at the minimum. Okay. Now how will we keep travel? So again one concept is called the learning rate. So every time if you have initialized with the some weights, that is W, means this is a WT, is actually weights of the all parameters, and in that you have to change with the delta LW, which is the gradient which is a gradient of the loss function, and then you have to multiply by some constant value that is called learning rate, and then you have to keep decreasing this loss, this weight value. right? This is how and but here again the alpha is another another hyperparameter that you have to understand if what should be its value. But for sake of simplicity, right now we are assuming it is very less, around 10 to power -5 or -4. Okay. Now, so yeah, we discussed that if this alpha value is very big, then we may get overshoot into the minima. We can go in the minima. Again, we can go out of the minima value. If it is very small, it may not. You may never reach to the minima. You may be stick here because this is so small value. Okay, and optimization may take very long. So now optimizing the loss function again. So we have the output, expected output, and the network parameter we already discussed. This is the loss function, and what we have to do is derivative of the loss function. So we already took the derivative of the loss function. Okay. So here the derivative of the loss function with respect to the weight, but if you see this equation here, we don't have this equation is not directly dependent on the weights. So what we have to do, we have to take this value, or we have to this value by head from here, and then this value, you can see that this equation is actually dependent upon the weights, and then you have to take a differentiation or derivative, basically I have to say. So this is, so what we have to do, we have to use a chain rule. So the chain rule is a fundamental of the whole computer science. Okay, so the chain rule is a very first invention, very first discovery in the computer science. That is the fundamental of computer science, and this is the most important discovery in this field. So here we have dl by del w, and to get this, we have to apply del L by del Y and del Y by del W. And if you see, this is actually nothing but the same thing, but we can make this whole derivative or very simple, right? So this is del L by del Y. So this is directly with respect to the Y, and this is 2 by head minus by I, same thing. And then this is another term del Y by del W, and this is that equation. And then again, what you will do, this is with respect to the W. So here you will have only X values, and W will be all 1 1 1 1. Okay, so this is a very simple expression we got from here. And similarly, we can extend this expression for the some number group of observations here we have. Okay. No, that is what we learned. It was very simple. Now we are now ready to extend this concept for the 2 layers. Okay, up till now we have discussed the only 1 layer. In 2 layer we have W1, right? So here we have 3 weights. Again here we have 3 weights. Again we have 3 weights. So here itself we have 3 plus 3 plus 3, that is 9 weights. So this is the matrix we have here. Previously we were having only 3 weights. Now we have 3 weights. Here is 9, and again 3 here, that is 9 plus 3 equal to 12. Total number of weights are 12. Now we have to do the difference, take a gradient of the loss function. That is very complex process, right? And then top on that we also have the activation function. So I will introduce what is the activation function. So activation function is here. You see this activation function are there. There's so many activation functions that we will discuss. So here this is sigmoid activation function, and then this will also go into the derivation. So that is a very complex process to do so many gradients, calculate so many gradient manually. So what you have to do that, right? So here I am saying that gradient of loss with respect to the W1, W2, and what is capital W1? 9 variables here you have. Here you have 3 variables, so many gradients you have to take. And if you say that I didn't have to take because computer will do that job, still computer will be very slow if you have millions of weights, right? So what you have to do that? So what here I have 2 points. The function more complex, how much now much harder to drive these expressions instead of using computational graph and back propagation. So here backpropagation will help us to get these gradient done very quickly, right? So now I will introduce what is a backpropagation. So this is the backpropagation. So this is what we have to take a derivative of that, right? And backpropagation, here you see the data is flowing in the forward direction. This W1 and X and B. So W1, you can assume this is nine variables here, and this is connected with the three in X. Okay, three variables in the X. So if you multiply by W1 with X plus B1, you will get this Z, right? And the Z will go into the H. H is nothing but the activation function. So H is nothing but here your sigma of Z, and then you will get the Y hat, that is it, that you have to estimate. So this is the estimated value, nothing but the W, this W2 multiplied by H and plus B2, and this is the by hat. And then you have to calculate the loss function, which is you have already ground truth here, and you have to subtract with the by hat. Okay, this is what we have already learned till now. Now backpropagation is calculating the error in the backward direction, in this direction, from here to here, from here to here, here to here, here to like this. Okay, so why the backpropagation is very important? Because we can avoid so many redundant calculations. We need not to calculate um, the gradients of so many variables. You will see that why we don't need to do that. And the intermediate computation like activation, derivative, so many computation will be reused. So here you see, if you wanted to do the back propagate error, so what you have here, L equal to y prime minus y, here you see y, this minus this, then what you have here, so derivative of this L with respect to the y prime, then this derivative of again L with respect to the W, right? And then derivative of L with respect to the another, this H, here you see, and then derivative of L again with respect to the this Z. So you have to take derivative of L with respect to the all variables. That is, these variables are y prime, W2, here you see W2, H, and here you have a Z, here you have W1, and here you, that's all. These are the only parameters we have to take derivative of L loss function with respect to those model parameters, right? Again, I'm reiterating, model parameters are here W2, H, Z, W1, right? So these derivatives we have to take. Okay, and if you see that some derivative already we have taken, so this variable you see we can directly take from here, and this thing, this gradient we have already derived. This is here. This gradient already derived. This is here, right? This gradient, all these gradient we have already derived previous step, right? Just before that. So we can use all these gradients. Okay, so that we don't need to do that. And few gradients we of course we have to get. But out of those, some gradients we don't need to calculate, just like this, del H by del Z. And what is H? H is nothing but this activation function. And if you take the del H by del Z, so what you will have here, the same thing, this the derivation of that. So that is actually, again, this direct function. You don't need to take that. So this function we can use here. So many, we don't need to do that. A lot of calculation we can avoid. That's why backpropagation can be intelligently used to reduce the computation time of the neural networks. And that's why today what we see, deep learning is very fast because of this method we are using. Okay. So this is a key idea. Now we can discuss. Okay, now I understand how to means how model learns. You understood, I guess, how model learns. Basically, you have to use few components, that is the gradient descent and back propagation together to minimize the loss function very quickly. This is how how networks learns. Now, next thing is, so many hyperparameters are there in neural networks. How to choose them? For example, optimization techniques. This is SGD optimization techniques, ADAM optimization, and Haggard means the adaptive gradient, SGD means stochastic gradient descent plus momentum. Okay, so many things are there. So many optimized techniques. But so to understand which techniques is important, you have to again go through a lot of mathematics. But the simple part is what is the correct learning rate, right? So which learning rate is good? So this is a red one, very good learning rate. This is good. This is good, high learning rate, but your loss, you see this loss function not getting minimized. So is it good? The blue one, is it good? Low learning rate, but loss function not getting minimized, is very high learning rate. Loss function is even forget about the minimization, it is increasing. Which learning rate is good? Of course, you will see the red one is very good, right? But you don't know about that. What is how to get this red line? You never know before once you start doing it, whatever you do, but you while looking at the loss function, you will never able to know that it is this what curve what we are getting, that is this curve. Whatever you are doing, maybe this is this curve. Who knows? So for that, which learning rate is good, we don't know. So what we can do, we can adaptively vary the learning rate. Start from the very large learning rate and then start keep decaying over the time. Okay, so this study could be very helpful. So this comes under the design choice, how to select the hyperparameter. So rather than having a fixed learning rate, you can keep vary the learning rate with the epochs. So under design choice, that you what means if your data is really learning about on the whole population and is generalized, or it is learning on only specific data set where you are learning what data you have in considered, right? So for that, you have to divide some data into the training, testing, validation, and then keep observe the validation versus training loss. So here you see this is the blue one is the validation loss. It's not decreasing, but training loss is very decreasing quickly. What does it mean? It means that your network is learning very fast on this kind of data set, what you have already given, but what data set has not seen by the neural network, on that network is learn nothing. So what do you have to do now? So you have to make some models, you have to make model some simpler, right? So that can still because you have a lot of weights, bias, and they are learning that particular data very quickly, but they are not able to learn on the range or variety of the data set what you have. Now here you have a underfitting. So underfitting, you will never know it is underfitting, but what you feel your loss is not getting minimized because the output you are not getting the correct output what you are expecting. That means if it is happening and your loss function is very close, that means training and validation loss, then you have to think of increasing the number of layers. How can you how can you improve the model performance? Okay. So yeah. Now, the design choices, sometimes you never know that, but you have to debug it. Means after once you start having the output, then you have to think, okay, what to do that now. So this is the play two. Maybe so here you have play two. That may be a bad initialization. So initially your loss is not decreasing, right? So loss is not decreasing. After the loss start decreasing. That if you see this kind of curve, that means your initialization was not perfect. So what you can do, maybe because of bad initialization, this loss is not getting minimum or getting minimum very slowly. So you have to again restart your training. So that can you do, right? And this is loss is decreasing but very slowly. So what you can do, that you can try a higher learning rate. With learning rate is very small and it is slowly it's reducing. That means you have to increase the learning rate. And this is very healthy loss curve. Okay. And further, because since everything is perfect, you shouldn't you should reduce loss, reduce learning rate very soon, because otherwise it may again start fluctuating, or loss may start increasing after some point of time. That's why you have to get settled at some point. For that you have to reduce the learning rate. If your In this case, his learning rate is decayed very quickly, but but in that time you keep higher learning rate longer, because it was learning very quickly here, but after that it stopped learning, it stopped reducing. So you can have higher learning rate for some more time. Maybe it may go down a bit more. Who knows? And this is accuracy, where you see this accuracy are still improving because validation, and this is the blue one is validation and this training, and both are increasing. Accuracy is increasing, so you shouldn't stop here. You should have some more number of epochs. Okay. And which kind of network you need depends upon data set you have, a problem statement you have. If you have a one-dimension data set, you try to use the fully connected neural network, or dense network sometimes called. If you have the images, you can have a CNN. If you have a one dimension that had dependency on the previous output, previous input, then you can use a LSTM kind of neural networks. Okay. So you can also do some data augmentation to increase your data set size, so that you can have more diversity in the data set and you can have a better accuracy. Sometimes you need it. And it's up to you. You should know that how can we get the more variety into the input data set. If you are getting the overfitting into the loss function, then you can use some regularization. And here we are using the dropout. So a lot of the dropout is actually not removing these connections. Dropout is actually meaning is the output of this neuron, we are making the probability of output having this neuron is 0. So there very slight different terminology we should understand. So to drop out, to again I'm repeating, you can use dropout to make a neural network not overfitted. This is another thing, batch normalization. You always should use the batch normalization within the layers. So this is the mean value, this is the standard deviation, and this is the x value, which is x, the input data minus mean divided by the standard deviation. You should ask what is this value. This epsilon is actually, we add some value, very small value, so that this whole result shouldn't get infinite. Okay, so if it is 0, then it will be infinite. So there are batch normalization layers. They are very helpful to improve the loss function. So this is in the loss term, you can use regularization. So what we are doing, we are adding some weights. So you see this is lambda times of r of weight. So some weight we are adding, that means we are trying loss not to get minimum by adding some weight value. So what it will do, it is actually, so your loss was reducing very quickly in case of training, but validation loss was not getting decreased. That's why you are trying not to let that training loss decreased, so that ultimately your whenever it decreases, the validation should also decrease along with the training data. So for that L2 regulation, L1 regulation, elastic net regulation, there's so many options are there. So the L2 regulation is very popular. So there are some activation functions. So for different applications, people use, if you wanted to have output that is limited to 0 to 1 range, you can definitely should use a sigmoid. For ReLU, if you have output only positive output, you should use the ReLU. And sometimes you also need the negative values in your output, but very limited. That time leaky ReLU you can use. Nowadays in CNN, a lot of people are using leaky ReLU to improve and showing that their performance has been improved. So there are different class of neural networks. So you see this is a fully connected neural network or dense network, multiple hidden layers you have, and it is very commonly used neural network, and one of the oldest one. In the recurrent neural network, here you have dependency upon the previous inputs, and this is very good for sequence neural sequences. And this is the convolution neural network. Here you have, rather than having weights over here in the connections, here you have weights into the kernels, and those kernels are getting multiplied, that getting convoluted over throughout the image. So now the new concept I was talking, I was saying that I will introduce, that is the physics informed neural network. So nowadays, what people are doing, people are having some data set, right? And input data, and they are using some neural network, and they are getting some output. And how they are getting output? Using neural network. What neural network is doing, no one knows. Okay. This kind of model is called black box model, because you took neural network and you are mapping input to output, but it doesn't have any physics information. It is very commonly used. It's very easy to use. That's why they are very popular. But this kind of network takes us so much data set and a lot of time to train. Okay, so what we can do, since we have developed so many physics, biological, chemistry related models, we developed this in a since long time. So why not we are using that information? So rather than using only data, we are using some data and some physics information along with that, and we are trying to work somewhere here that is called a physics informed deep learning networks. And for this kind of problem, you require relatively less amount of data set, and they have better interpretability and transparency. Because if you're let's assume you are adding 2 plus 2, it will always give you the 4, right? If you're using plus sign, 2 plus 6 always give you the 8. But if you're training network that is mimicking the addition, so it can have 99.999% accuracy. Still, one time you will not get 2 plus 2 equal to 4. You may get the 5, 6, 7, anything. So the physics information, if you somehow incorporate into a deep learning model, it will be very helpful to get the more interpretable or transparent output. Okay, that's very important nowadays. So how you can do that? Very first, you can use physics model into the deep learning. Okay, physics model to use the physics model into the deep learning. You can simulate data set, like for example, okay, you wanted to add two signals. Two signals means two sinusoidal signals. One having amplitude 4, another having amplitude 2. That means you should get the sinusoidal, another sinusoidal having an amplitude 6. But you are training network on a data. Rather than doing that, you just take the addition here and simulate data set into the values. That means you can have some physics model to data set generation. That means this is how you can incorporate physics model into the deep learning. So the physics models to simulate training data set, you should simulate training data set using physics model. That's the one approach, right? Another approach is you can incorporate physics information within the layers. And in Keras, I know that there is a very popular function called lambda layers. In lambda layers, you can call any function, and then that layer will start acting as a hard-coded physics model, and you can use that model within the layers. Here you can use a transform, for example. Okay, then another way. The third way is using physics information into the loss function. So here you see this is some signal, for example, some signal, and from this signal you are getting some output, and then from this output you are again that output. What you are trying to do here? You're trying to, from this input signal, you wanted to get the frequency domain output. And this frequency domain output, again, you are giving the inverse Fourier transform. Again, you are getting signal, and this signal you can compare with this input signal. This is how we can make self-supervised but physics-informed deep neural network. This is another way to incorporate physics information into the deep learning, right? So yeah, so that's all from my side. If you have any question, I would be very happy to answer.
Thank you so much, Dr. Singh. Participants, if you have any questions, you can ask.
Maybe a participant means are just thinking, are recollecting whatever going
Yes, sir.
on,
Yes, sir.
whatever
I
went
mean,
on in
Yes,
this
sir.
presentation.
Sir, I
So
have
maybe they
granted the
can write.
permission to
Yeah.
unmute themselves.
Yeah. So they can, if they want to reach out after the presentation, of course they are welcome to do that.
yeah, sure, sir. Sure. Thank you. Okay, so in that note, Thank you so much, Dr. Singh, for your insightful and highly informative talk on deep learning fundamentals for medical imaging. And on behalf of the organizing secretary, Dr. Gaurav Kumar, I would like you to please accept a virtual memento as a symbol of our gratitude. Thank you
Sure.
so much, sir. Thank you.
Yeah,
Thank you so
sure.
much
Thank
for
you
your
for the
time.
invitation. Yeah.
Thank you. Thank you, sir.
I think I have to cancel this, right?
Yes, sir. You can.
Stop sharing. How can I do that?
So you can go to the. You can escape from the PPT and then you can close it.
I already skipped from the PPT. So maybe I can close it.
Yes.
Okay.
देखो देखो
I close it.
Yes, sir. That's good, sir. Thank you. Thank you so much, sir.
Yeah.
Next, it is our pleasure to welcome Dr. Indu Dore, who is serving as an assistant professor at the Department of Computer Science and Engineering at Motilal Nehru National Institute of Technology, Allahabad. She holds a PhD in computer science from Jawaharlal Nehru University, New Delhi, where she specialized in secure and energy efficient schemes for IoT under the guidance of Dr. Karan Singh. With a strong academic background that includes an MTech in computer science and technology from JNU, Dr. Dore has developed deep expertise in areas such as IoT security, optimization algorithms. Just sorry for this interruption. IoT securities, optimization algorithms, trust evaluation, cryptographic techniques, and wireless sensor networks. She has published multiple research articles in reputed international journals, including IEEE Transactions of Industrial Informatics, Wireless Networks, and Annals of Operations Research. Her research has focused on innovative energy efficient clustering protocols, certificateless cryptography for industrial IoT, and meta heuristic based optimization techniques for secure data transmissions. Dr. Indu holds a UK patent on an IoT based soil moisture indicator and has filed an Indian patent on an energy efficient air pollution monitor. Dr. Dohre is also active in international conferences and certified workshops, blending strong technical skills with hands-on experience or expertise in tools like MATLAB, NS2 and 3, and the PVC library. Ma'am, we are delighted to have you guide us through her topic, secure and privacy challenges in sensor-enabled IoT, role of sign encryption. Ma'am, we warmly invite you to begin your session now.
Thank you so much, sir.
Your slides are visible.
Thank you so much, sir, for giving me this opportunity to provide a lecture on smart health innovations, integrating the imaging sensors and biomaterials. When we talk about the sensors, it's not only about the how it is made up of, but it is also shows the importance of how the data is being transmitted, how these sensors are going to use in various applications, and how this data is transmitted from one device to another or to the local host, and how the security users is important. So in this consideration, I would like to provide a lecture on security and privacy challenges in sensor-enabled IoT, the role of encryption. So So let's begin with what is IoT. IoT is basically refers to the interconnected network of smart devices which collects, share, and process the data over the internet. So here we can see that there is one four-stage IoT solution architecture is given, where the primarily stage one, there use number of sensors and devices are established, and in the second stage, the data is being
Ma'am,
transmitted. Hello,
excuse me, ma'am.
hello,
Ma'am,
yes,
your voice is not clear. Uh, Actually, there is
okay.
a message from participant that your voice is
Yes.
not clear.
Am I audible now?
Yes.
Okay, okay. So in the stage third, the analytical and pre-processing work has been initiated, and finally, the data is being transmitted to the cloud, and where the security measures are required in every stages. So how this market is being taken by the IoT? We can see that up to 2025, there are 55 billions of devices are interconnected, but it is in 2030 up to it is prediction that up
Sorry,
to
ma'am.
11 point. Hello.
Yeah,
Ma'am,
sorry to interrupt.
actually, I
Yes.
think you need to be louder because they are telling that still the
Just,
voice is
yeah.
not clear.
Hello. Am I audible now?
Yes, ma'am, you are audible, but it seems you need to be bit low. You need to talk
So,
bit louder, it seems.
Okay. 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 Okay.
Okay,
Sure.
ma'am.
Okay.
Sorry for disturbing you.
No issues. Okay. So it is prediction that up to 2030, it is approximately $11.1 trillion of the market will be occupied by the IoT industries or various applications of IoT, where it is going to use various number of sensors. So what is IoT basically? You can see that the sensors are going to use in approximately every applications. Sir, am I audible now? Now? Is it okay, voice?
It's okay, ma'am. You please carry on.
All right. All right. Okay, so in approximately various applications, we have to cover like smart farming, environmental awareness, various transportations, analytics, Industry 4.0, and now it is Industry 5.0, trusted environments, several variables, and as well as in a smart home everywhere. And in fact, it is hugely used in connected health or smart health. So basically, IoT components includes the local process, network, cloud, analytics, and then after analytics, it is comes to the user end or user interface. Basically, we required various number of communication sensors or devices, and where it reduces the human interventions. And of course, it supports the huge number of devices with growing in the market. Now we will consider to the what are the various privacy challenges which are coming to the security. So in the healthcare system, the identification of patient, it should be authenticated with the doctors. Authorization of data is very much important, as well as in traffic control, traffic management violations rules are need to considerable, and smart farming, the access control information where it is traveling, where it is like transmitting, as well as in a smart home and smart devices, we can see that the security is required everywhere, as well as we are using the cloud for the third party authorization is needed in the cloud, and cloud is going to use in every applications. So it is very much required to secure the data transmission from sensor to the base station, and base station to like it is transmitting it to the cloud or user end. There is everywhere the security is needed. Now, what are the common security threats which are nowadays it is coming? So first of all, data breaches and unauthorized access. The lack of strong encryption leads to the data breaches basically. And this, secondly, we will come to the man in the middle attack, where the attackers like perform the interference in the communication while this communication is being happening in between the sensors or sensor to the base station or base station to the cloud if the data is transmitted, as well as identity spoofing, and the device spoofing is also one of the major security concern or security threat is coming. So where the malicious entities like impersonate, which acts like a legitimate devices, and why that it is it is taking the identity of other device or user. Similarly, denial of service, which is like attackers overload the IoT networks and causing the disruptions, as well as the weak authentication mechanism and key management is also belongs to the where the poor password policies or insecure key handling increasing day by day, and it is like creating the problem to the security for the devices which are using in various applications. Similarly, when we come to the privacy challenges, the unauthorized data collection is being harvested from without the user consent, as well as lack of user control. Users have limited access to the managed collected data, and but it is like some of the adversary or malicious devices being taking the control over the data. Similarly, when we talk about the IoT ecosystem, there are various insider threats are also coming, like in terms of cyber attack, in terms of black hole attacks. There are various insider threats are also exploiting the IoT information, which is very sensitive to the many applications. So let's come to the next, which are traditional cryptographic solutions and limitations. Of course, there are traditionally we are using various techniques, like for the encryption, we are using AES, RSA, ECC, elliptic cryptography, and many more, which is usually providing the data confidentiality, which is securing the data. In the same way, when we talk about the digital signature, it is ensuring the authenticity and integrity of the data by signing the digitally, or various elliptic curve DSAs also comes into the picture. While once we are creating or making one complete secure system, there is a need of key exchange among the devices. So we need to enable the secure communication devices where the key exchange is also one of the major important solution is coming into the picture, where we use Diffie helmet or elliptic curve Diffie helmet. Next, what are the various? We are already using many of the cryptographic solutions, but still it has limitations of the IoT. Just because IoT is needed, like high computation. Okay, and these devices are very like energy efficient or resource constant, we can say. So here limitations of the IoT security, where we need high computing, where these solutions are providing high computation cost, but IoT devices have limited processing power. So we need to generate the lightweight solutions for the IoT. So high communication overhead is one of the also limitation of the traditional cryptographic solutions. So next, it is the process of authentication and encryption. Like traditional security mechanism require multiple steps and leading to the inefficiency some of the times. So these are some of the limitations of the traditional cryptographic solutions. So what we need, there is a need for the various application. We need a unified security approach, by which the encryption mechanism can provide a lightweight security. So what is encryption? Basically, encryption is a cryptographic techniques that integrates the encryption and the digital signature into a single step. So when we talk about the encryption, there is also authentication mechanism comes as well as signature, but into a single step. So it is it is reducing the computation power as well as communication cost. But the encryption is needed. So definitely, I've told you that it reduces the communication while transmitting the data. The data is being transmitted, the key is also transmitting. So overall, it is reducing the computation and communication cost, as well as it provides the confidentiality, integrity, authentication, non-repudiation, scalability, and many more security features it is providing. And it prevents from the various attacks. It may be mirror in the man attacks, replay attack, identity spoofing, impersonation, legitimate of the identity. Many of the attacks it is preventing. So let's begin with the, just because this encryption, it is of encryption as well as digital signature. That means authentication as well as providing the signature into one step. So we will begin with the authentication protocol. What are the authentication protocols, and what is the purpose of basically authentication protocol? So this authentication is the process of verifying the identity of an entity, such as user, process, or device, to ensure that who they are who they claim to be. This is just one of the definition which is provided by in the William Stallings. This is the book of the like author of the cryptographic and network security. Similarly, there are many more definitions, like authentication ensures that the parties involved in a communication and transaction are genuinely who they claim to be. Similarly, this is the other definition which is provided by the ISO IEC 27000, which is information security standard. This is the definition is authentication is the provision of assurance that a claimed characteristics of an identity is correct. Basically, what we want while we are providing the transmitting the data, we just want that wherever the data has been transmitted or where we are sending a message, that message should be provided to that receive, which is to whom you are sending the messages. This is one majorly the purpose of the authentication. So ensuring the secure access resources, protect against the unauthorized activity, foster trust into the communication, meet compliance requirements. These are some purpose of the authentication protocols. And as we can say that this authentication protocols are used many of the applications for the network security, for web-based applications, for mobile applications, for cloud computing, for enterprise systems, financial services, healthcare, IoT, government, defenses, everywhere it is going to use. Now, I would like to show some various types of authentication where we are using some of the methodologies. So here we have some types of. The first one is single factor authentication, where we are using one of the factor, which is maybe your password. For example, while you are logging into your email or Gmail account, then you need to use your password. This is one type of authentication type, and this is very simple and low cost. So the password based authentication can come to the single factor authentication, while we talks about the multi-factor, and there we used 2+ factors. For example, while you are logging into the banking application, some of the time it used your biometrics. Many times it is while your transaction is happening, you are using one of the OTP, or you are using one of the different password there. So there we use multiple types of factors. So it is definitely, it is strong security provide, but it requires a huge setup for this. Okay. Similarly, the third type of, which is biometric authentication. In biometric authentication, the physical or behavioral test of the test has been going to happen. Like if you are using if you are logging into or opening your mobile phone, you are using fingerprint. While you are working in the banking, you are using your fingerprint, maybe some of the work. So it is highly secure, but is there you need a hardware device for the fingerprints. So next it is token based authentication. Basically it is providing the hardware and software tokens, and it is used for the dynamic security provide, and it is also requires the additional devices, like if you are using OTP apps like Google Authenticator. So this is just one kind of example. Next, it is passwordless authentication. Similarly, while you are using the single factor authentication, it is password based, but in passwordless, some biometric or some token, some OTP can be generated. So it is, but it is, of course, it is relies on the external system that someone is sending to you one OTP. So let's move to the next slide, which is what are the role of the authentication in cybersecurity landscape. We can see that authentication is not only providing the cybersecurity; it is foundation on which a complete system is built. Like when we are talking about any of the industry, there is a need of the cybersecurity, which is the base. If it is breaches, then the data is being can be used or can be wrongly used. Okay, so in the digital age, identity is the new perimeter, and authentication is the key for securing it. So you can see that the role of authentication in the cybersecurity, which provided the access control and identity verification. It protects against the insider attacks. It enabling the secure remote access as well as it mitigating the cyber threat. It enabling the secure communication. It is enhancing the user trust and privacy. It is supporting the various regulatory requirements. It is using in the, you can say, military applications. There are huge role of cybersecurity. So, in general terms, what is authentication? Simply, when we are, this is just one basic example, when you are logging into your system, once you are opening your system, your sign in is there, you are writing your password. So, how this password is basically matches in system, in normal system, there is one file which is stored in the, it is your shadow, you can see. But while you are logging into, let's suppose you are logging into your Gmail account. So here first time when you are signing in, then you write one password. It may be 2 or 3 times. Then this password is converted into, there is applied one of the function which is known as hash function. Basically, hash function converted your password into hash value. And when you second time, let's suppose you are logging into your Gmail account, so this hash value is basically going to check again to the password which is stored in somewhere. It may be on your local host or it may be your server. So it will check. Once it is the hash value is matching, then only you can access your system, your login account, your whatever you are your banking system, anywhere. Okay, so firstly, it is like matching the hash value of both the password, whatever you are in present one, and the last one, wherever you are building one that password. If it is like matching, then you are entering into the system or entering into that application. Okay, if it is not, then completely this verification is going to fail and you cannot access it again. Next, when the core concept of authentication is basically authentication, there are basically majorly comes 3 words, which is authentication, authorization, and accounting, which is generally it is known as AAA. So authentication, basically the key features of authentication is it ensuring the device or user, it is comes first, like basically what is user on the terms, what is used for the authentication. In the role of cybersecurity, it definitely prevent the unauthorized access to the system data, establishing the identity of the user or devices which are requesting to access. When it comes to the second point, which is authorization, the key function to provide the what resources, basically we talks about the what resources or actions are permitted to one entity, that may be your user or device. The role in cybersecurity is basically it is ensuring the users that if the that the legitimate user can only access the resource they are authorized to be. So this is restricted to the sensitive data and system and operations as well. The third point is the accounting. The key function is tracks the actions, the one authorized user is performing some of the actions. So it is whether this user is accounted to this work, these actions or not. So it is going to tracks the actions, perform the ensuring the accountability. So it helps to detect the malicious or unauthorized activity by the adding user actions. It provides the trail for compliance purpose and assist in the post-incident investigations. So these 3 more important concept of one authentication. Next, we will move to the What are the key terms? So there are some of the key terminologies which are going to use in authentication while we are providing the authentication, like credentials. In credentials, we have username or password, some biometric data, some of the like your some biometric data or passwords you can use. In the next one, it is token. Basically, it is used while you are performing single sign-on. Like once you got the OTP, then you are using that OTP, then you will provide it to access these applications. Okay, so this is like a token is a digital object used for the authentication and access control. It acts as a proof of identity, often used for the single sign-on and session management. For example, like access tokens or refresh tokens, again and again, we are using tokens there. And token basically provide a secure way to access the resource without continuously using the passwords. Okay, next, we will talk about the, again, certificate. While we are um, making one authentication protocol. So in bigger environment, there is one certificate authority, which is provide the like ownership, like which has the ownership of the certificates, and it gives the certificates to the various users. So again and again, once it is needed, so once it will check the certificate, then it will enter, like it can be used or access that data. So certificates are used for the encryption and digital signature usually to ensure the integrity and authentication of the communication. Session means once the interaction between user or systems been happening, and at that time a login session for some time off it is provided. So one user is allowing to interact with that system in the given time span only. Okay, so this is what one session. Now let's go deep into the key cryptographic principle for the authentication. So here we comes to the encryption, which is majorly we are using in like vastly in every application. So encryption is basically of two types. The first one is symmetric encryption, and second is of asymmetric encryption. In symmetric encryption, the plain text is being encrypted by the same key, which is known as your secret key. And once the secret key is being transmitted or received by the receiver, then it will use for the decryption, and then the plain text can be like get. So various example like AES, DES, RC4 are some of the examples of these symmetric encryption algorithms. Next to the asymmetric one, the plain text is being encrypted by the public key and being decrypted by the private key of the user. Okay, so here we use two types of key. The first one is public key, and secondly, it is private key. So basically, this is used for password protection, secure communication, secure key transmission, secure key sharing data. This is all some of the examples of these encryption methodology where they are going to use. Next, lastly, we have talked about the hash. So hashing is also one kind of one-way cryptographic function that transform the data like password into the fixed length hash value. So here we have plain text. We perform some hashing algorithm. We get some fixed length value, which is hash value. Okay, this is completely like we can say that here we are using. So there are various kind of mechanisms for hashing like SHA-1, SHA-2. These are several like standard algorithms, SHA-256, SHA-512. This is all being used for the storing the password, maintaining the data integrity like this. Next, we'll talk about the cryptographic authentication. Then there is also great role of digital signatures come. The digital signature, what is digital signature basically? Once the cryptographic technique that ensure the authenticity and the integrity of a message or any of the document. So if the sender is transmitting the data, it is applying by the hash algorithm, some of the hash value is coming, then sender also like use the encryption by the private key and digitally signed the document. Then this document is going to the network and it is received by the receiver. So receiver will also check the digitally signed document, and then it will use the sender public key. It will decrypt the message. It will decrypt the hash value. If the both of the hash values are same, then it will be say like, okay, this is the authenticated document. Okay, so basically, majorly it is used for the identity verification, non-repudiation, scalability, various application of digital signature in many of the applications. Now, this is most important. The fourth one, it is public key infrastructure. So, public key infrastructure is a framework for managing the digital keys and certificates using the public key cryptography to ensure the communication and verifying the identity of the user, devices, and services. So once the data is being, you can see in this diagram that there is one sender which is signing or which is signing one of the document by the private key, and certificate authority is also certifying this, and this is like transmitted to the for the verification authority. So once it is recipient will receive the message, it will check whether the signature is okay or not, whether if it is okay, then only it will receive. So it is like certificate authority and verification authority plays a bigger role in this public key infrastructure. Next, as we can say that previously it was multi-factor authentication. So the primary objective of the multi-factor authentication is to have something that means your password or pin. Something you have, that means you may have your smart card, your ATM card while you are accessing the bank. Something you already are, like you are using your biometric, then this is like multi-factor. Then if it is three of them as okay for this example, then only you are granting the accesses to the application. Okay, so this is majorly comes to the layered security. And the last one is here for this one, the session management and tokenization. Basically, the session management is very much important. This is the cryptographic tokens which are used to securely managing the sessions. So here, various stages are coming for securing this one, like the username and password is reaching to the server, then server is verifying, then it is providing the sum of the session for some of the time, then it is accessing the application, then user accessing the application, then it will be verified by the server. If the server ID is verified, then it is like, okay, it is protected. Server has been, like services has been provided. Okay, so tokens are also used in various APIs for the authentication to grant and control the access without exposing to the sensitive credentials. Now, there are some of the basic protocols, which are like standard protocols, which is used by the Windows or some of the applications. The first one is password-based protocol. For example, it is CHAP and MS-CHAP. Next is token-based protocol or authentication, OpenID Connect. Some of the examples are like or squared authentication, certificate-based authentication is SSL or TLS, biometric behavioral-based authentication system, multi-factor authentication system, which we already has been seen. So here one of the one of the common protocol for the authentication. The first one is CHAP. This is known as challenge handshake authentication protocol. Here you can see by this image that there are one client is there and one server is there. Firstly, client request for the connection. So once it is requesting to the server that please provide me one secure connection so that I can access your applications. Okay, so what servers do? Servers send one challenge. Okay, so firstly verify yourself. Okay, once it is like accept the challenge, then it is providing some of the keys or it is decrypting the key, then it will be provide the response like hashed challenge or shared secret key. Once it is verified by the server, then only it provide the sum of the session key. Okay, for this time you can access the applications. So CHAP is a protocol for the authentication remote user basically, and it is using three-way mechanism, which is request, challenge, and response. Okay, then basically the majorly it is protects against the replay attack. Okay, and it also used MD5, one kind of hash function, And it is developed, basically it is developed by IETF, Internet Emerging Task Force. So this is everywhere, like many of the applications in Windows, like 7 or 8, it is using the CHAP application. Next, it is O authentication. So it is known as open authorization as well as. So O authentication is an open standard for token-based authentication, and authorization is basically provided the third-party application to access the resources on behalf of the user without sharing the even user credentials. So it's like you don't need to share your credentials, but you are allowed to like access one of the some of the applications which is provided by servers. So here you can see there is one user which is resource owner, and there are some client applications, and some of the applications are also shows here, like applications data, application servers, like cloud-based services. So what clients want, it is want some services. So firstly, it will ask to the API that please grant me some services. The access is protected resources, so it will issue some tokens that okay, I provide you one token. So it will also authenticate the grant accesses, and then once it is like authenticated, then it will be like allowed to access the resources which is in terms of cloud based or whatever it is. Okay, so key features are it is delicately accessing the using tokens, ensuring the limited and time-bound access. It also supports the single sign-on, and majorly it is login with the Google API securities, social media integration. It is used vastly there. Next is Kerberos. Yeah, this is like used everywhere, like in this is developed by the MIT and used in Windows, like previously it was used like Windows 2000, and later in the wide for authentication protocol is it is using. So it is network authentication protocol designed by the identity verification over the non-secure network. It uses the symmetric key application. That means this is they are going to use the same key for the encryption and decryption. It is relies on the trusted third party known as the key distribution center. Basically, it is KDC. Okay, so here you can see the first one is user. What is done? Does it logs onto the workstation, and it provide like it requests to the server to or server on the host. So for this process, there are two entities like authentication server and ticket granting server. There are two entities are basically on the server side. So user requested that please grant me a ticket. So by the Kerberos or by the authentication server, one ticket and session key is being provided. So again, it will check, it need to check with the ticket granted server as well, that request server granted ticket as well. So once it has ticket or session keys, then it will check, and once it is provided like 4 times, then only it will access to the server. So workstation promotes user for the password and uses the password to decrypt the incoming message, then set the ticket and authenticators that contain the username, network address, and the time to TGS. Okay, so then the TGS will decrypt the ticket and authenticator, verifies the request that being created for the requesting the server. So when it is request has been granted, then workstation send the ticket and authenticator to the server, and lastly, the server verifies that the ticket and authenticator matches, then grants the access to the services. If the mutual authentication is required, the server return the authenticator as well. So this is complete process. This is 6 steps. Verification is being done for the accessing the applications. It is there is several drawbacks of this process as well, that the single point of failure, let's suppose if the authentication is server is not working, that complete process is not going to happen. So it is like the steps are depends on the each other. The secured partially depends on tight clock synchronization. Yes, tight clock synchronization is also needed. That means that they need like little time only in between that. Okay, and it is primarily used inside the organization. Next, it is secure socket layer or transport layer security. And finally, it is biometric behavioral based authentication systems are also used. In secure socket layer, the primarily a protocol for encrypting the data and transmitting like SSL TLS is used for the mutual authentication between the client and the server, which are using the certificates. The certificates may be like X.509 certificates, and where they are using like in some of the HTTPS websites or VPN authentication. So this is like secure socket layer. On the layer of transport layer, the security is being provided. Next, finally, it is biometric or behavioral authentication system where we are using voice, iris, retina, facial recognition, fingerprint recognition, hand geometry. In fact, nowadays, like signature is also coming on like, and behavioral biometrics, typing, rhyming, mouse movements, walking style, gaits, as well as. So these are some of the biometric and behavioral based authentication systems. Next to coming to the what are the security threats are coming. These are like there are so many types of attacks in the cyber security terms of, but here we will discuss some of the security threats. The first one is of phishing attack. Basically, a phishing attack is a social engineering attack where the attacker tricks user into the revealing the sensitive information such as password or token by impersonating the legitimate entity. Let's look it into this figure. Like there is one hacker which is wants to access the Gmail account of the target one. Okay, so what it will do? It will send one phishing email to the target. So let's like in generally we can see that that's several emails are into the spam. Okay, so victim can do like it can if it is opening the spam, let's suppose, and it is opening one of the message and which is sent by the one of the hacker. So once it is like there may be some several glooming links. So if the target is clicking on one of the link, then it may go to the phishing website, and then only the hacker will get the crucial information or credentials. And after getting the credentials, it can access the confidential information, whatever connected to that Gmail account. Let's suppose if the bank account is being connected by the Gmail account, then the hacker may get this information as well. Because the first step is for the like banks to the your Gmail, then it may go to the your some of the confidential your username and password, then it may hack to that. So how it is works basically, user receives several fake emails, website messages that appear legitimate, and user unknowingly input their credentials, which are sent to the attacker. So there are what are the impacts? The authorized access to the user accounts, data theft, and financial loss may be happening. So there are several preventions as well that use multi-factor authentication, but not all the time it is feasible. And use education or identifying the phishing emails. This is just one of the measures you can say that if the person is knowing, then only open the email. Otherwise, check it out once that whether it is the phishing email or not. Next, the second threat is brute force attack. So in brute force attack, there is one password guess list. Okay, the attacker like guessing the passwords again and again, uses password like credentials or password, and then it attempts. If it is one is successful, then if the combination is get successful, then it will get the information and it may access your accounts. So there are some prevention measures like use a strong complex password and use different password every time. Okay, this is also generate a demand of service just because it is using some of the system overload. So there are huge impact of these attacks. Next is replay attack. Basically, replay attack is also sometimes it is known as, but there's little difference only. The replay attack is middleman attack on some of the time. So, replay attack then occurs when the attacker intercepts the legitimate authentication data, like token or credentials, and it reused it and regained the unauthorized access. Okay. So, Basically, what attackers does, the original communication is happening in between user and server. So what it will do, it will sniff the communication, it will try to hack, like it will not modify the data, it will not intercept, or it will not do anything, like it just want to see the look into the data. Okay, so attacker captures the authentication message and success and token, they intercept the credentials and send again before the system obtaining the accesses. Next is credential stuffing. So stuffing involves the stolen username or password from the previous breaches. Like from the previous breaches, it like stores all the information, and it is a collection of stolen login system have. Now, what is the like? They use some of the software. It will trial and hit and trial cases going to do. If this is like firstly it will log in, secondly it will log in, and again it will log in, and it will try to reset the password and credentials. How it works, attacker leverages the automated tool to test the credential across the multiple platforms. It reuse the password and make user vulnerable. And it is compromising the multiple accounts and data breaches of the financial fraud may be happening. So there is also there is one of the we can say that prevention measure that use multi-factor authentication or password-based authentication, or you can use different unique password for each services. Like if you are using Facebook or let's suppose your Gmail account, use different passwords for both of them. Next, it is the middle attack. Basically, it intercepts the communication between user and the system to steal or manipulate the authentication data. The attacker position themselves between the user and authentication server, and they eavesdrop or alter the message, gaining the access to the credentials or data. Basically, the prevention measures are use encrypted channels like SSL or TLS. Now, how to make one authentication protocol? It is like what are the majorly principles for the designing of the authentication protocol? So we need to come into your mind that what one system need. So according to the need of the system, we need to develop the protocols. Like for example, for mutual authentication, uh, if one system is required mutual authentication, it ensure the communicating parties and authenticate each other using the distance limit. Let's suppose if there are two parties A and B. So what A will do, A will say, like sign or encrypt the message, and then the B will decrypt the message by the B's key. Okay. So basically, it is used for the prevent the unauthorized entities from exposing the using as the legitimate user. So mutual authentication is very much important. These are the some principles we should apply for building the authentication protocol. Next is we need to bring into our mind that there shouldn't be any replay attack or any kind of attack. So there is a nuance that is only once one key can be used. Okay, so there is nuance NA and NB. Ensure the message freshness or preventing the reuse of old messages. So we need to like use every time one new key. That is also protect some against the replay attack. As well as the next is confidentiality. That means the plain text or message should be encrypted by one's key, and once it is transmitted, the B can be like decrypted to the and get the original message. Okay. And the data is encrypted with the shared key and AB, and ensuring only the authorized party can access the message. This is like primary goal of our work. And this protects transmitting the data from the exposer. Next, for designing the secure authentication protocol, there is a need of confidentiality, session key establishment, and the message integrity. Like for the confidentiality, again, we need to encrypt. There is like lots of mathematical things is being using for developing one authentication protocol. like we need to use the discrete DLP we are using, like discrete logarithmic problem, and greatest common divisor as well. So here, this is general terms that how this is encrypted. So the data is encrypted with a shared key KAB, ensuring only authorized party can access the message. Again, it is the case of encryption and discrete. This is general terms, generally confidential, and it is purpose to protect the transmitted data from the exposure. Next is session key establishment. Here you can see that KAB mod P, which is Diffie-Hellman basically using the secure session key is established between two parties using public-private key exchange. Then session key should be established there. Okay, and it is ensures that the session key for every session, we are again and again changing the key for every session. When it is provided, then the key should be changed. Then integrity of the message. Again, the message authentication codes MAC ensures that the message M has not been tampered during the transmission. It ensures the messages are not modified in the transmit. So here you can see that MAC KAB of M, which is using hash function H KAB. The last one is once we are developing or designing a protocol, we need to also keep in mind that correctness and verification of the protocol is also needed, and formal proof is also very much required for the developing one authentication protocol. Let's suppose if it is correctness verification, once we are doing verifying our complete scheme, then we should ensure that the encryption and decryption of the signature or verification operation, it is correct or not. We should check. Okay, so one, it is so this is the mechanism. Like firstly, it is encrypted by the public encrypted by the private key of the user, and it is decrypted by the public key of B. Then if it is the same key or different key, like it is here, they are using different keys, then it should be like similar of that message. Okay. Then again, it is verified by the public key that after signing it is we are getting the same message or not. So correctness verification is also very much important while we are making or designing one secure authentication protocol. So what are the purpose? That it is guarantees that the protocol functions as expected. Finally, once we are making one our designing our protocol, then security proof is also needed. There may be two types of security, like formal and informal. Informal, basically security proof checks informally or theoretically that it is like overcoming various attacks. Okay. Informal security measures is basically proof that if there is some distinguished encryption, like if there is one adversary is there and the message is being encrypted, and second message is also encrypted, the probability of access by this adversary should be less than epsilon, where epsilon is majorly negligible probability bound. Okay. And basically the purpose is mathematically assurance of the security, that our whatever the protocol we have designed, it is mathematically assured, it is correct. So these are some of the hardness is also used for checking our security measures, like if it is ROR model or indistinguish models like IND-CPA, indistinguishability under chosen plain text, IND-CCA, chosen ciphertext attack, IND-CCA1, non-adaptive, which is like identity CCA2, adaptive identity CCA2 is the standard encryption security hardness basically. It is also being checked by the extensive unforgeability models like EUF, CMA, or if we talk about the encryption, where we use IND-CCA and EUF-CMA for the security jointly. So for the encryption, we make sure that our model is IND-CCA, that is indistinguishable or under the chosen plain text attack. So these are some hardness as well. Apart from these three, authentication and confidentiality, session key management and integrity, and correctness and security verification, we should also check our protocol, whether it is like hardly secure or not. Okay. Next, what are the like, once we build one protocols, then it is also should ensure the inoperability with the standard compliance requirement. Like it is ensuring and it should meet the legal and regulatory requirements, as well as we also check the scalability, like that whatever we build one secure protocol, it should be scalable to many of the various systems or not, like not only one application, whether it is applicable to other application or not. Okay, so there are key authentication standard as well, like O or 2.0, X.509. These are some certificates also provided. There are regulatory compliance as well. Once we like build one security mechanism, then it should be focus on the user consent, data privacy, securing data handling. This is like provided by the GDPR, PCI DSS. These are some regulatory compliance that it is strong authentication or authentic. It is providing, whether it is providing the strong authentication or not, as well as it is also ensure the secure access to healthcare system and protects the patient data, which is HIPAA. And so nowadays, basically, these were previously it was like standard protocols. Nowadays, we are using many of the applications zero trust authentication. In zero trust authentication, the primary goal of this authentication is to never trust anyone. Like once someone is entering into the organization or trying to access the data through the online, then it should always check whether it is the part of that organization or not, whether it is the part of that organization network or not. It should always check. So this is the like zero trust authentication is used. Okay, so all the access, whatever they are doing, that must be verified, authenticated, and authorized before granting the access to the system. So the prime motive is do not trust anyone. Next is the nowadays the role of blockchain and decentralized identities mechanism is also using for the authentication, which is blockchain. Okay, so blockchain is basically decentralized identities. So technologies are revolutionizing authentication by providing the secure, tamper-proof, and privacy-focused mechanism. And here, one block is like data is everywhere. The primary motive of this blockchain is data is everywhere. Publicly, it is. So what whosoever ever is want to access, it is already in the system. Okay, so it basically eliminates the centralized data silos and enhancing the security through the immutability, enabling the self-sovereign identity, and it is also enhancing the interoperability as well. So we have read about the authentication too much and why it is encryption. I have already told you that it reduces the communication and computation cost. It ensures the confidentiality, integrity as well. It prevents various attacks like replay, identity spoofing, and different kind of attacks as well. So now, what are the working of IoT based encryption is basically there are like generally there are three steps. The first one is key generation. So here we are considering the ACC based. So there are sender and the receiver, which generates the private and public key pairs. The we need to have like public and private key under the consideration of asymmetric one, as well as it is computed using the elliptic curve Diffie-Hellman. We are considering like ECC based, so it is ECDH. Okay, Diffie-Hellman. That means we are using some hash of the function. Then again, in the second step, the encryption process is being done. So the first one is compute hash of the message, that is HMPB, and here the public key of the party B. Then generate the signature by SAH mod Q. Then encrypt the message and using the asymmetric key and send to the receiver. This is like encryption process. Once whatever you are using, like you are using hash function, do the hash and generate the signature as well into the one step, okay, directly, and send to the receiver. And the next step, okay, next is comes to the unencryption. While the data is being accessed, like received by the receiver, then it will perform the unencryption process. Then it will use the compute. It will compute the shared key, which is okay. So the shared key is also one kind of like use research perspective, that how this shared key is shared. Just because the network is also maybe like can be accessed by some of the adversary. So it is also one public key infrastructure comes into that picture. Okay. So here the compute the shared key, it is computed by the receiver and decrypt the message and verifying the signature using the sender's public key. This is like three processes. The first one, you need to generate the keys, generate the signature encryption process, transmit the data, and encryption process. This is the like general three steps of the encryption. Next, let's understand the application view of encryption mechanism. So here we are considering the healthcare system. So here you can see that this is the application of like a hierarchical architecture for the healthcare system, where we have one of the trusted authority, and we have several like entities like MCS, which is medical cloud server. There is one data owner, like we can say that data owner is there. Okay, which is also known as, just because this is the consideration of healthcare system, then we have patient health information. Okay, this is patient health information. Next, we have this medical cloud server. Okay, next we have this medical workers. Okay, medical workers or healthcare provider. Finally, we have this trusted authority. Basically, if we are using some certificate, then there is the role of the sometimes it is the role of the trusted authority as well to provide certificate. Or there may be some different authority, that is certificate authority, which may provide the certificate as well. Okay, so this is like different cases. Like if you are using certificate based encryption or encryption, or certificate less encryption, probable encryption. There are different type of encryptions as well. So here the trusted authority, what is basically does, this is like like it provides the secure sharing key to the fee owner, that means data owner, as well as provide the key generation as well. So many of the things being done by trusted authority. It is also provided the secure sharing key to this healthcare providers, and it generates the, for sure, it will have some of the information. It will gather the information, it will check the information, and then it will generate the key. Okay, so this is like complete, you can say, structure. And here, yeah, one of the also majorly important point, that how this access is being happening. Okay, so there is I told you that many of the mathematical models comes for the while you are building one protocol. So like you have to go through the mathematical model, like modular arithmetic, finite field, bilinear pairing, lattice based cryptography, modular arithmetic, prime numbers, large prime number, GCD as well, like greatest common divisor, extended Euclidean algorithm, integer factorization problem, many more. Okay, so here next is we can say that there is one medical cloud server. So medical cloud server, what is happening? So whatever the data it is like after encrypting the data, it is transmitted to the medical cloud. Okay, cloud. Then after once it is needed by the healthcare providers, it will access by their key. They should have key. So whosoever it is going to access the data, they should have the key. Okay. So here, the Meta Cloud server retains the unlimited storage to accommodate the periodic update of the patient's encrypted fee. And fee owner, or we can say that data owner, are patient and their embedded devices that are provided the fee. And healthcare provided the medical workers. Basically, you can see by the symbols, some of the doctors are there, nurses are there, or the data users whatsoever. Those who are permissible to get the access provided in the anticipated server. So how it is basically does. Huh. See here, I have told you that this is the work of those mathematics, right? So for the initialization phase, the user registration, which is being done by the set of the attributes and unique identifier has been used. Let's suppose it is of length L, and if see, this is the example of hierarchical accessing. So there is also access structure, which is LSSS for the data receiver is being used. Then system is initialized, like we are using some of the Cloy function, some of the field, as well as some generator of this field. And we need to also generate some large prime number like order of q. And next we have while we are generating the hash like hash, then we need to use some hash functions. And after that, this function, that message is being like encryption is being happening by the signing key, secure key of for the encryption, and secure key of decryption is also going to transmit, as well as the message is being secured. So here again, the generators G1 and G2 is going to use by the web function and evaluates the like this delta one and delta two. And after that, the T, that is your trusted authority, choose the one of the elements, and it is generated the public key, and finally it is transmitting the data. Okay. Finally, this output is being created completely, and then again after this output, the key generation is being taking place, and after the generation of the key, it will like encryption key and description keys also need to be transmitted to the fee owner, as well as once it will access the medical cloud server, and from the medical cloud server the data provider or healthcare provider will access the data, and then only it will be check. So there is you can see that there is a use in mathematics or hash function or cryptographic things are being used there. Finally, this is like you can see in the previous like example that signer encrypts the message on the given PK or by the access structure MU and row U, and by its private key PS, and after it's being generated. So this is all the like we can say that one of the example, and this is completely is being we need to do all these things for generating the one authentication protocol. So finally, this is all happening here. So, what are the conclusion? Let's come to the conclusion and key takeaways, like key IoT security and privacy challenges. We can like some of the things we can see here. We have seen, and authentication as an efficient security mechanism, and how encryption enhance the IoT security and reduces the overhead. And so one of the real-time application as well, like healthcare application for the encryption in IoT. So this is all. Thank you so much.
Thank you, Dr. Indu Dohore, for your talk.
Thank you so much.
And if any of the participants has any question, you can ask. I have given you the permission to unmute. Okay, so if you have any further questions, you can directly send it to Dr. Indu, or you can send it to us. We will pass it on. Okay, so just thank you so much, ma'am, for your encouraging and wonderful session. As a token of our respect and appreciation, we would now like to symbolically present you with a virtual memento. Please gracefully accept it from our side. Thank you so much.
Thank you.
Thank you so much.
Thank you.
So our final session for the day will be delivered by Dr. Pratibha Gaur, a leading researcher from SRM University, Sonipat. Dr. Pratibha Gaur is an associate professor at SRM University, Sonipat, Haryana, with over 10 years of postdoctoral research experience in host pathogen interactions. She earned her PhD at International Center for Genetic Engineering and Biotechnology, New Delhi, studying influenza virus pathogenicity in collaboration with the CDC Atlanta on understanding the pathogenicity of influenza virus. She has worked globally, including at the University of Sao Paulo, Brazil, Helmholtz Center for Infection Research in Germany, and the Hebrew University of Jerusalem, Israel, focusing on infectious diseases, immune response, and allergy models. Her current research explores host pathogen dynamics and allergic inflammation. Dr. Gaur has expertise in disease mouse models and serves as member secretary of the Animal House facility at SRM University. She is a recipient of the prestigious CNPQ Fellowship in Brazil, Talwar Foundation Travel Award in India, and Early Career Research Award in UK. She has also received a research grant from NHPC Ministry of Power India and has published extensively in reputed journals including Metabolism, Obesity, Frontiers in Microbiology, and FEBS Journal. Dr. Gaur will deliver a session on nanoparticles and biosensors for early diagnosis and targeted therapy of infectious diseases. Ma'am, we welcome you and request you to begin.
Thank you so much. Thank you so much for such a nice introduction. So I hope, can you hear me properly?
Yes, you are audible. You
Thank
can
you.
share your slides.
Before starting, I would also like to thank the organizing committee members and Dr. Saurabh Bharadwaj as well as Dr. Uvnesh, who has invited me for the talk. So thank you so much.
You are welcome.
So can you see my slides?
Yes, we can see your slides. Just put it on PowerPoint. Yeah, now
Is it
good.
okay? Okay.
Yes.
So today we are going to talk about the nanoparticles and biosensors for early diagnosis and targeted therapy for infectious diseases. Specifically, we will check that how these new techniques are being evolved and used for the diagnosis of any infectious disease, as well as we can use as a therapeutic interventions of these diseases. So, what is the basic idea behind these sensors or nanotechnology which we can use for these diseases? So, current diagnostic methods which often detect the disease at later stages, as we have seen, we have known about the cancer specifically, if we talk about it. So, if we come across at later stage, then it will create a problem limiting the treatment efficacy and patient's outcome as well. So we need to bridge this gap by enabling detection long before the symptoms appear. So it is better for the betterment of society as well as for the person who is suffering from these diseases. This is particularly critical for complex diseases like cancer, neurodegenerative diseases, and autoimmune conditions, including allergy, where early interventions can drastically alter the disease trajectory. So on your right hand side, you can see there are several diseases, and many of the patient, they are suffering from specific organ associated diseases. If we can diagnose them, we can use these technology, which is mainly coming from biotechnology. We can make the chips. So we will go through one by one that how we can intervene for the early diagnosis as well as for the therapeutics. So why we need to do it at the molecular level? So there are early indicators which, if we come across before even the disease is progressive, then we will be able to control it. So detecting changes at cellular and molecular level provide the earliest possible warning signs of disease onset. So these are mainly the genes which is associated, such as in case of diabetes, we know that this is a hereditary disease, meaning it is coming from either maternal or paternal side. So if we know in prior stage that this gene is responsible and it is present in the offsprings or children, then the kids, they can in later stage, maybe they can also get the diabetes. So these are the early indicators which we can easily diagnose, although we should be aware of all these parameters. Precision targeting molecular insights, allowing for highly specific and targeted therapies, minimizing the side effects and maximizing the effectiveness. So I will show you some of my work also, that how we can do it. Some of the work which we are doing here at my lab. Personalized medicine, understanding individual molecular profiles enable truly personalized treatment plans tailored to each patient, unique biology, such as in case of cancer, each person is having different kind of gene profiling. So if we will be able to give them personalized medicine according to their gene molecular level, then it will be called as personalized medicine. If we are able to do all this, then we can save the 90% chances of a person to survive and survive longer. So it is increasing the survival rate, such as we can give the example here for cancer. Any cancer, if we can detect at stage 1 level, then the giving the disease, the medicine and the treatment can stop the progression of that cancer. So 60% we reduce the cost, because at later stage, of course, once we know that there are less chances, the treatment also increases, and it can also come up to such kind of treatment which are still not in the market. They are just going to apply for the patient on the patient, that if they can get. So these are the expensive treatment. So if we know at early stages, we can reduce the cost, and of course the disease progression will reduce. So what are the materials we can use for these kind of assays? So microfluid chips. These are the chips which enabling precise control and analysis of biological fluid and cells with minimum sample of the volume, such as in case of dengue and coronavirus. So every one of us has been gone through this corona period. So we know there is a quick test which was coming that time. It was like a chip, so where we can add the saliva sample, and if there are 2 lines were positive coming, that means that the patient is positive for corona. Similarly, these chip can be used for dengue infection also. In case of dengue infection, so this is the chip which is right now in the market, is giving the antigen antibody reaction, and if patient is positive for this, again the antigen against this dengue virus is showing the line. So very commonly and known for everyone is a pregnancy strip also, that is for as an example of microfluid chip. About the biosensor, so these devices that convert the biological responses into electrical signal, allowing for rapid and highly sensitive detection biomarker, such as in India specifically, we are having a large population of who are having diabetes. So in each or in just alternate house, you will find the glucometer. So people who are diabetic, they have a tendency to check that glucose level in their blood sample. So that is an example of biosensor. For nanomaterial, there are vast example of nanomaterials, so which is being nowadays used for targeted therapy. So these innovation biomaterials serve as a critical interface between the biological sample and advanced imaging system, enhancing the sensitivity and throughout of the diseases. So basically how these chips work, as I just gave you the example of dengue infection kit as well as for corona. So as you can see here in the first panel, so here we can put our sample. It would be, it could be blood samples, urine sample, depending on the how these signals are being amplified and what we wanted to check on the chip. So this chip has a region where we can put the biological sample, which is applied. Here, the nucleic acid, which will be DNA or RNA, are extracted from the sample mix, and this is being amplified, meaning the signals are being enhanced, containing the reagent for isothermal amplification, which increases the amount of targeted nucleic acid which we want to detect according to the disease. After this, once this process is done, then we have the detection level, where either we see the two lines of one for test and one for control, or so patient the sample would be either negative or positive depending on the signals what we get here. Using the DNA and RNA probes, which we can see, so we can also attach these on the chips. So these are short labeled sequences that specifically bind to the targeted nucleic acid to give the signals. Then nowadays, there is another very high throughput technology is coming in the research field is organ on chip. So what is basically organ on chip? So as you know, there are primary cells. So as the name itself is suggesting, organ doesn't mean directly the organ is putting on this, but there are primary cells which we isolate from this organ. So as a whole, we will have all the gene and which is present in the organ on the chip, and then we will be able to check each of the disease in the physiological condition. So this kind of technique is overcoming the limitations which we have in vitro system, where we are just trying to mimic the situation, although sometimes it is not fully, because we are doing everything in the lab stage. And in vivo system, which is mouse model, although close to the human, but it's not human, it is animal model. So if we are able to do this organ on chip model, we will be mimicking the functional unit of human organ, which is using the biometric stimuli of recreating the physiological conditions. So it is the more relevant technology which we can use for any kind of disease progression. So in heart muscles, in lung, alveolar, in solid tumor, it has been established, where we do the biowiring, and we use the vacuum pump for vacuum suction for these kind of organs on chip model, and as well as biorealities. There are several advanced imaging is being used for early detection of any disease, whether it would be infectious or the disease which is, for example, a cancer. There are optical microscopy, one of the high resolution visualization of cellular and subcellular structure using the light, including advanced technique like super resolution microscopy. Including this optical microscopy, there is atomic force microscopy, as well as scanning electron microscopy and transmission electron microscopy, which is being very, very relevant and useful for the early diagnosis without even penetration of a needle. So these are non-invasive techniques which we can give the signal before even the disease reach to a later stage. So there is another one which is commonly known maybe by all of you, MRI and PET imaging, which is non-invasive technique offering deep tissue penetration for microscopic views, increasingly combined with molecular probes. And here we can detect a small portion of extra tissue or anything in our body. Then another technique, which is photoacoustic imaging, which combines this optical as well as ultrasonic detection for the higher resolution of imaging within the deep tissue. So imaging is another. And then the next, as we were talking about the nano materials, so here comes the nanoparticles. So nanoparticles is nowadays being very popular for the drug targeted delivery system for the therapeutic interventions, where the nanoparticle, these are the following the range from 1 to 100 nanometer in size. So these are very, very small in size, and it is very showing the very less harmful effect in the body. So they are composed of synthetic or semi-synthetic polymer carrying drugs or proteinaceous substances, which is antigen or drug, depending on the disease, what we make or encapsulate these nanoparticles within. Drugs are entrapped or encapsulate in the polymer matrix, particularly or solid solution, or may be bound to the particle surface by physical adsorption or in the chemical form, and then we test directly in the towards the organ by various interventions. Basically, these nanoparticles, they are following into type of categories, nanosphere and nanocapsules. As you can see in the picture, nanosphere, these are the matrix system in which the drug is physically and uniformly dispersed. Or, however, in nanocapsule, these are the system in which the drug is confined to a cavity surrounded by a unique polymer membrane. So on the basis of that, you can see the size of this nanoparticle, you can assume and compare with the tennis ball that how small is the size. So as we said, 1 to 100 nanometer. So basically the antibody, as I was telling you about the dengue chip, which is having the antigen and antibody reactions. So the size of this is 10 nanometer. Virus, which was coronavirus, dengue virus, you name it. So the size of the virus is 10 is to power 2 nanometer, bacteria 10 is to power 3, and then cancer cells belong to 10 is to power 4 to 10 is to power 5 in the initial period of their stages. So these are the several type of nanoparticles which we will see. So according to the material, they are being classified on carbon based, metal based, dendrimers, composite. So these are basically the 4 different type of materials, nanoparticles. So first one, which is falling in the category of carbon based, as an example, fullerene. So these are composed of at least 60 atoms of carbon, each bonded to 3 other atoms, perfectly smooth, hollow inside, inert and non-toxic. So these are used to carry the drugs to the target cells. Most of the nanoparticle are used for the drug delivery system. Nanotubes, they are a sequence of nanoscales C60, which is carbon atom, arranged in a long, thin, cylindrical structure. Buckyballs expanded, so they are also called as buckytubes and buckyballs from the center into the cylinders. So these are being used for the delivery. Why? Because it is having the larger surface, so we can even entrap and add more drug molecules, and they have the property to release very slowly towards the disease. Then another type of nano particle, which is quantum dots. These are crystalline structure from inorganic substances. They absorb white light and then re-emits it later in the specific color, which depend on the size of quantum dots. So these are used for molecular labeling. Very, very good probe for the early diagnosis kit. So we can use them as a fluorophore also, because it is giving the colors, and we are able to recognize that at which side, at which molecular side we can we see the disease markers. Then there is liposomes. These are the bilayered vesicles with aqueous volume enclosed by a membranous lipid bilayer. So most of the studies, they are done on these nanoparticles. They were the classical one initially. They were being, before the advanced technology, so they were being used a lot for the drug delivery. Then we have nanoshells, and these are the concentric spheres consisting of a typically silica core and a metal shell, spherical glass particles with an outer shell of gold. You can see here, this is the metal shell, this is the silica one. These spherical glass particles with an outer shell of this for destroying the tumor cells. Then dendrimers. Dendrimers, these are technically a polymer and synthetic 3D macromolecules formed using a nanoscale fabrication process. These look like a tree like a structure and also used for the drug delivery. So what are the nanomaterials used in the tissue engineering? So there are three different, we can categorize in three different parts. So metal nanoparticles, conductive polymers, and bioceramics. Metal nanoparticles are having gold, silver, and platinum, which is further divided into different, classified in two different elements. Such one is doped element, where these gold, silver, platinum nanoparticles, they are being intermingled with the zinc, magnesium, or manganese ion, and then they are doped to this. The another one, which is using the carbon, such as carbon nanotube, graphene, and in case of conductive polymer, polypyrrole, polythiophene, and polyaniline. In case of bioceramics, there is calcium phosphate, bioactive glass, and hydroxyapatite. These are being used. So now what is the advantages of using these nanoparticle? So as we are discussing that these are very, very site-specific drug delivery system provides us for the cure of any disease. These nanoparticles, they help to achieve maximum therapeutic responses with minimum adverse effects. So side effects are very less in this case. They are active and passive. Drug targeting can be achieved by manipulating the particle size and surface characteristics of nanoparticles. These can be administered by parental, the oral or nasal route. So any route we can use for this. These are being used for research purposes as well as for clinical purposes. As we have talked about, there is early diagnosis. So in case of drug screening, so labeling is very important, where the quantum dots were being used. Gene delivery system diagnosis, where the device and labeling occurs for the research purpose, as well as for a clinical purpose for the drug delivery in the therapeutic intervention, where we can use it as a therapy for any disease. Detection and diagnosis of disease biomarkers. So in case of disease, as we are talking about, so in case of bacterial infections, which is very, very common, and nowadays we know there is antimicrobial resistance is spreading all over the world. However, in India, this AMR is at higher level, and the scientists who are working in this field, they are saying that it will be a silent pandemic by the 2050. Why? Because in India, we use the antibiotic without even prescription. We are getting it from any pharmacy. And once the bacteria is already being resistant towards that antibiotic, the antibiotic stop working. Okay, so this is the problem which is happening, which is called antimicrobial resistance. For this, we need different type of nanoparticles, or we need different type of drugs, antibiotics, so which can replace the antibiotics and work against those bacteria. So nanoparticles, they kill these bacteria in different by using the different mechanism. First one is biofilm disruption. So usually bacteria is having the tendency to make the biofilm. Once the biofilm, it is like a web structure, it is very, very hard to treat. So this is the bacteria itself, it is taking the advantages of this quality of bacteria, and this is very bad for the human being. So here we can use the nanoparticle because it is the showing the targeted drug delivery. And to disturb this biofilm, we can stop the protein synthesis of that bacteria. So another mechanism which we can use for nanoparticle, by which nanoparticle can treat the bacterial infection, is the bacterial cell lysis. How if you remember the liposome one, that is because the bacteria is having lipid bilayer, so it just disrupt that, and then it is destroying the cell because the inner material of the cell is disrupted, so everything is out and it is killing that bacterial cell. Enzyme inhibition, DNA replication, and ROS toxicity. These are the other methods by which nanoparticle is being used to target the bacterial infection. Apart from bacterial infection, there are several other microbial infections such as fungal infection, also known as mycotic infection. So in case of fungal infection, we can use these nano particles, these nanotechniques for the early detection of this infection. So how we can use? So we just need few ml of blood sample, and then we can identify various species of fungus such as Candida, Aspergillus, Penicillium, Mucor, Fusariums. These are the fungal species which are commonly present. If you remember, even the corona case, the people were not dying because of the corona in later stage, although they were dying because of the secondary infections, and secondary infection was mucormycosis. So it was also known as black fungus. So if we can easily detect these fungus according to their sensors such as nanorods, nanowires, nanoprobes, and nanobarcodes, surface plasmon resonance, and DNA microarray. So these are the methods, nanotechniques, which we can use for the detection of these diseases. Various processes which is being employed for formation of the metal nanoparticles. So there are three different types by which we can prepare the nanoparticle. First is physical, biological, and chemical method. Which is the most conventional one is the chemical method, where etching, mechanical milling, laser ablation, thermal decomposition is being used for the preparation of nanoparticle. In physical method, electrochemical, ultrasonication, laser ablation, irradiation, evaporation, and condensation occurs. However, there is the third one, which is very, very important nowadays, that is called the biological method. Because each the other conventional traditional methods, they are having the side effects. So we need some kind of new intervention which is not creating any kind of side effects, or as well as working directly towards the infection. So here comes the biological method, so by which we can make the nanoparticles. So this is also called as green synthesis, where either we can use plants or microorganism. Today we will focus on the plant. So in case of plants, we can use leaf, root, flower, fruit, depending on their phytochemical activities, their properties, what do they have. So in why we can use, we should use the green synthesis for the preparation of nanoparticle, as I told before also. So there are they are very eco-friendly, they are non-toxic, biodegradable, minimum environmental impact. On the other hand, in the case of chemical synthesis, this generate a hazardous byproducts, which is again back to the environment. So in case of safety conditions, safe handling is provided if we are using the biological method. Although in case of chemical synthesis, it involves the toxic corrosive chemicals, which is very risky for the workers who are preparing it. The process is very complex in case of chemical synthesis, although in herbal it is simple and fewer steps. The yield is high, although we have to make it more, start with a larger amount, but yield is high in case of green synthesis. However, the chemical synthesis, it occurs at industrial level, but if we consider the other safety parameters, then the green synthesis is always better in this case. Concerning the biomedical suitability, this is enhancing the biocompatibility for medical uses in case of green synthesis. On the other hand, the chemical synthesis, which is potentially toxic due to the chemical residue which is present in those chemical synthesis nanoparticles. Okay. So what is the basic mechanism? So I am showing you basically the green synthesis. So here these synthesis and how do we prepare. So basically we need to have the solvent is very important, in which solvent these medicinal or herbal plants are being resuspended, dissolved, and the pH and the other temperature and other conditions are very important in preparation of these particles. This is going through a redox reaction. Once this metal is being neutral, this atom, then it is forming or accumulating all together, making the club, and these clubs are then showing the capping, and these capped one is the stable nanoparticle which we can use for further applications. In case of plant, as we also discussed, we can use leaf, flower, root, fruit, depends on their medicinal property. Then we mix it up, and these nanoparticles, which is coming in various sizes, as we discussed before also, this belongs to 1 to 100 nanometer. So it can vary. Each nanoparticle can vary in their sizes, and they have vast application in medical, agriculture, wastewater treatment, photocatalytic reactions, etc. So it is showing the capping, and once the capping is done, they are forming the stable form of nanoparticles. In case of plant nanoparticles, when we have the crude extracts, they have bioactive compounds also. So what are these bioactive compounds? They have additional value, additional properties, which is showing the antimicrobial activity. So it is very good field to explore, which is giving us the new hope for AMR, which is antimicrobial resistance. So there are bioactive compounds such as flavonoids, glycosides, oxalic acid, alkaloids, thiamine, polyphenol, etc. So which is present in the plants, but we should be aware, we should know before even starting that which kind of bioactive compound is present in these plants. Once the nanoparticle has been prepared, we use it for drug delivery system. And how does it happen? So they have very specific kind of coating, which is very direct to the infectious cells. So a nanoparticle, you can see here, which is carrying inside a pharmaceutical agent inside the core, while its shell functional to a binding agent, meaning what? This is a bacterial cell. It is having some kind of receptor which is specific for the infection. Then this is having the ligand. It is like a lock and key model. So this ligand will specifically bind to this receptor, and then it will engulf, will go here. Through this binding agent, we can do the target. Okay, this is the targeting. which so this called as a target cell. The functionalized nanoparticle shell interact with this cell membrane. Then the nanoparticle is ingested inside the cell and interacted with the biomolecule inside of the cell. These nanoparticles breaks and the pharmaceutical agent is released, which is then later kill the bacterial cells because it is having the targeted therapy. So these are few examples which I will wanted to show you. So these are the nanoparticle which is having the lipid core. This is the siRNA. siRNA are very specific, which is silencing RNA towards a specific disease. On your right hand side, you can see this is the healthy tissue. This is the diseased one, unhealthy tissue, and treated with a non-targeted nanoparticle. And in comparison to this, if you will see this one, which is having the unhealthy tissue and treated with a targeted nanoparticle. So you can see the resemblance of the healthy and the targeted nanoparticle. So if we give the correct treatment, the disease progression will stop. It will not reach to this level. Okay, this is the targeted drug delivery of a nanoparticle. We can also use for the medical imaging purpose of these nanoparticles. As we have talked about, the quantum dots are very important because they emits the light at a specific wavelength. And these are quantum dots, depends on its diameter. So you can see this is the cadmium selenide nanoparticles. The structure as it resembles here, it is having different diameter is having different color according to the wavelength. If the quantum dots, these are injected to a subject, to a patient, to a mice, then it is being detected by the exciting light, as you can see in these images. So these are the nanoparticle which is reflecting the light. Diagnosis and in sensing we can use, and it is having a broad application. So where these nanoparticles, as you can see, they are coated, molecule is specifically attracted to the molecular signature. Again, the antigen antibody reaction. So here we have a antibody against a disease which is binding to the cell membrane, and this is having the receptor against this. So it will particularly directly binding to this target. So this is how it is called targeted therapy. So these nanoparticles, these can be functionalized in such a way that specifically target a biomarker. Thus, the detection of the nanoparticle is linked to the detection of the biomarker and to diagnose this any disease. So particularly which antigen is present on that disease. Okay, so receptor ligand binding. These nanoparticles, how do they perform in action? So another example where we use in the MRI test. So these are the ferromagnetic nanoparticles, which is associated with the human IgG. So human IgG is again antibody receptor, so which specifically bind to the protein A, which is the bacterial surface protein. Okay, so this IgG is binding to protein A on this staphylococcus. This is a bacteria. Which can be detected through the MRI. MRI is magnetic resonance imaging. So here you can see clearly, this is the accumulation of a functionalized ferromagnetic nanoparticles on the Staphylococcus aureus. So this is bacteria and nanoparticle, they merge together, and that is how make the conjugation, and we can visualize in the MRI if the patient is infected with the Staphylococcus or not. Now, the green synthesis work, which I wanted to show you, that how we can prepare these nanoparticles in lab and what are the application in the infectious diseases. So one of my PhD students, she is doing this work. So basically, as I discussed before, also there is a big problem of MDR, multiple drug resistance. And we have chosen Candida and bacteria also we worked in 2 different lines where we have synthesized the herbal plants. They have the vast medicinal properties as well as the nanoparticles. So these are showing the antifungal drugs, because there are several fungal drug which is belonging to azole family. So fluconazole basically are being used for against the candida, but nowadays it is also showing the resistance. So we need new kind of therapeutic intervention. So here we goes to the green synthesis. So she has done this work. And what we have done, we have isolated several medicinal plants. I'm just showing you one of it. So we take out either from leaf, from root, from shoot. You need to find out that which part of the plant is having the bioactive compound, irrespective of the disease which you want to study. Further, to purify this, you need to make the powder of it, filter it, and then prepare the nanoparticle. As I showed before, for the biological, we use the metal one, which it could be silver, gold, platinum nanoparticle. We chose silver nanoparticle, and we have the whole standardized protocol. So after that, we found out the right palette of nanoparticle, which further we characterized. So this is the work where we have synthesized the herbal silver nanoparticles by using the rotavapor. We have tried to concentrate our nanoparticles. Concentrate the crude extract first. Later, we added the silver nitrate to convert this crude extract into the silver nanoparticles. And we initially started with a 20 gram of amount. Later found out that 135 milligram of nanoparticles we obtained at the end. So we tried, which I am showing you today, is we tried with 2 different method. One was from dried leaves and another from fresh leaves. So from fresh leaves, we initiated with 50 microgram, and at the end we got 8 milligram of this nanoparticle. To characterize these nanoparticles, we first chose the preliminary experiment by using the UV visible spectrophotometer. And you can clearly see here, this is the silver nanoparticle, which is only silver nanoparticle, silver nitrate. And here you can compare these 2 graphs where we have the silver nanoparticles from dried leaves, and this is the one which is from the fresh leaves. So the shift which is coming at 390, we confirm that this is the nanoparticle has been prepared. Later, to further confirm it, we performed the FTIR. So this is only for silver nitrate, where the peak was coming at 3,288, which is shifting with the nanoparticle with 3,315. So which is further confirming the formation of nanoparticles. Similarly, we found the same result, similar result in fresh leaves from the herbal plant. We at the end, we confirm it with the electron microscopy, where you can clearly see the size of those nanoparticles. So these are the nanoparticle which is synthesized from the plant extracts. And here the magnification is different. So we found out that 100 nanometer, at 100 nanometer, we observed our nanoparticle. Further, to check the application, as I discussed, how we can use these nanoparticle in infectious diseases. So we have checked in antibacterial as well as in antifungal disease. So here we checked that against the E. coli, and interestingly, we observed that 8 microgram per ml for both dried as well as for fresh. We found out that 8 microgram per ml nanoparticle is active against E. coli. E. coli is causing several diseases in case of patient, and there are several antibiotics which are now registered showing resistance against E. coli. So this is which was further confirmed with the drugs which is being used in the market. So our results were quite positive, as you can see here. So these are the drugs which is in the market, and this is our drug, which is 8 microgram per ml. So the plate reflects the same as in the graph. Similar result we have found in the resistant strain. So we had two different type of E. coli strain. One was susceptible, another was resistant. In case of resistant, we checked our nanoparticles, and we observed that 128 microgram per ml was the concentration which was active in this resistant strain. So it was not that resistance strain is resistant towards our nanoparticle, the green nanoparticle. Then in a case of antifungal also, as I said, we have checked in two ways, antibacterial as well as antifungal. So this work was performed by my another student, and she has checked in Candida albicans. Here we have gone one step further. So as you can see, so these are the minimum inhibitory concentration which we usually check to know that if the nanoparticle is effective or not. So this is first we checked only crude, where we see the 19 mm zone was present. In case of crude extract, we have also checked the bioactive compound, as I was continuously repeating that bioactive compounds are very important in green synthesis. So we found out very good activity against Candida albicans by using the bioactive compounds. Here again, these are the fluconazole resistant strain of Candida, and this is the sensitive one. And in both the cases, our bioactive compound was showing at 128 microgram per ml. So it was showing the good activity. Then we wanted to see that this is ubiquitous in different strain of Candida. So we have checked with various strains, Candida auris, Candida tropicalis, and Candida parasilosis. So we have already checked against Candida albicans. Here we combined our nanoparticles with the bioactive compound, and we found out very interesting result that this is showing the synergistic effect if we are using the bioactive and crude extract both altogether. So just to tell you that Candida auris, maybe you have heard just 1.5 years ago, it was showing the catastrophic spread in USA, where it is a ear infection basically, and when Candida grows in the ear, it basically kills the person. So Candida tropicalis, which is very, very common in India. So these two strains are common in India, which is either showing the oral infection, so thrush, so mainly in kids it happens, and which further lead to asthma also, if the patient, if this kind of fungal infection doesn't go or remain untreated. So we have checked these, as I said, against clinical strain as well as among all the Candida strain, and found out the good activity of these bioactive compound as well as the crude extract of the herbal compounds. So nanoparticles of the crude extract. Further, to confirm this, we went and checked the growth curve of these Candida auris, Candida glabrata, as well as Candida tropicalis. So as you can see in these graphs, the SD is the standard one without any treatment. If we grow the Candida, then it grows like this. This is the normal physiology of Candida. Then with our nanoparticles, so this is from the dried, this is from the fresh. So you can clearly see that with the fresh leaf nanoparticles, it is completely stopping the activity. However, with the leaves also it reduced at 32 microgram per ml. So similar we have seen this is with the fresh, and this is with our another plant, which is showing 128 microgram per ml. The similar pattern we have seen with the tropicalis as well. Here we have the dried at two different concentration, 32 and 64. So this is the dried nanoparticle, and this is from the higher concentration of the dried leaf nanoparticle, which is reducing the growth of tropicalis. So remember, the tropicalis is mostly present in India and creating mostly the UTI problems also, specifically in females. Then with the fresh, we have found out 32 and 64 microgram per ml. It is showing the good activity. And another plant also showing these nanoparticles showing the at 128. However, as the concentration decreases, we wanted that one. So the 32 one is the good one. Then we have the Candida glabrata, and we checked our green nanoparticle against this. Here we couldn't see any difference. As the growth pattern of Candida glabrata was going, our nanoparticles were not able to resist that growth. So it means these nanoparticles, which I just showed you the results, it is working on tropicalis as well as albicans, but not and auris, but not on Candida glabrata and some of the clinical strains of Candida glabrata. So basically, these silver nanoparticles, they are having the unique property and including very strong antimicrobial therapeutic effects. So these are showing the advantages in the medicine, and green synthesis, as we have already talked about, that these are eco-friendly, safe, and non-toxic. So good to use. Now we are checking these nanoparticle in vivo. So as we have discussed how they work, so we administered into the mouse, and then these nanoparticles basically accumulate in the targeted tissue, where it goes through the bloodstream. And as I told you, there is receptor ligand binding. So it directly goes to that specific site and do their pharmacological action at that site. So just to show you, I prepared this animation that how when we give the nanoparticle, how does it go directly to this. Okay, so when we are adding the nanoparticle, so this is a model of hepatitis where we wanted to do the liver infection, and then we wanted to check that these nanoparticles are specifically going to the liver or not. So it works. Then very briefly, due to the time constraint, I am not going too much in detail the other work, but another line of work which we are continuing in our lab is on allergy asthma. So here we are trying to make a biosensor in collaboration with IIT Delhi, Sonipat campus. So what is not done till now is basically, you might have heard that in Delhi NCR region, there is a huge pollution as well as population present. But the pollution is reaches to the extreme level during this September till February time. So due to that, what is happening, there are several kind of diseases, especially the respiratory diseases and allergy. Specifically, if you talk about the kids, the kids who doesn't have any history, they started taking the inhaler. So we wanted to check that what we can do for that. So basically, we know what is inflammation. If you get the heat rash, autoimmune disease, any infection occurs, and it shows allergy. Okay, allergy can be of various kind. I'm not going into much detail, but these are the inflammatory inflammatory responses which get exaggerate and sustained without a apparent benefit. Even it causes the severe adverse situations. So which we can see. So very common example of it in India is, except asthma allergy, of course, there is urticaria, which is very, very common in India. So when there is any inflammation in a patient, it causes either heat, redness, swelling, pain. So this all is happening due to either loss of function or gain of function. Okay, when you have some additive effect, then it will be gain of function, which is not even required. But due to that, then all of this happens. So, as I just said, there are multiple news papers published, and they are showing that how this pollution is affecting the population. But there are several biosensor which is being used for the pollution checking for environmental pollution, and by checking these, we see that which specific allergen can be recognized. However, it is not personalized or let's say local based, region based. So what we are doing now, we are having the clinical data, as well as we did some experiment. We found out that what are the prevalent allergens are present in this Delhi NCR region. And now, excuse me, now we are creating the sensor for the allergy as well. So it will give the early diagnosis of before even the pollution will start. So this is with this, I would like to first thank you all for your attention and patience. And of course, my university, this is my a small group at Center for Drug Design, Discovery and Development at SRM University. So if any of you have any questions, and so you can contact me. And of course, I at the end, all the funding and my collaborators, I would like to thank them. Without them, nothing is possible, all the work. So you can contact me if you have any questions, so on my email ID. So it's here. Thank you. Thank you so
Thank you.
much.
Thank you. Thank you, Dr. Gaur. If any participant has any question, Dr. Radhika Raheja, I think you have a question. You can ask. Unmute yourself. Yeah.
Hello, ma'am. Thank you very much for that nice lecture. I just wanted to ask one thing.
Mhm.
For these antimicrobial tests that you were showing, what was the solvent that you used for dissolving the extract and the nanoparticles?
So initially, we have to optimize all the conditions. So we were first checking in water. So water is best. Otherwise, methanol, ethanol, and then we also check by using the different ratio. So either 20% ethanol or 80% methanol. So there were various different solvents which we use. For each of the plant, it's different.
But then for the nanoparticles, when you have metal ions, in that case, will that nicely dissolve in ethanol, methanol?
So at the end, no, it was in PBS when we were checking the MIC.
Okay.
Mm.
So that would be a suspension, no? It won't be a solution, right?
No, it was suspension.
Okay. Thank you, ma'am.
Thank you, Dr. Raheja, for your query. Is there any other one? Okay.
Hello.
So, yes.
Ma'am, whether that ethanol or methanol shows the antimicrobial effect also, so whether that shows the nanoparticle or the solvent?
No, so we use methanol and ethanol only to dissolve it. For MIC or for antimicrobial activity, we didn't use it.
Okay.
Yes, of course, ethanol will
Shows the
that
activity. Yes.
yes,
So you
yes.
directly put the nanoparticles in that of the wells?
With the culture. So for the growth curve, first we grew it with the nanoparticle, as I said in the PBS.
Okay. Thank you.
Thank you.
Okay, thank you very much, Dr. Gaur, for this highly technical yet accessible talk. Your insights into early diagnosis of infectious diseases are of immense relevance in today's healthcare landscape. Please accept our virtual moment as a token of appreciation. I request Dr. Gaurav, who is the organizing secretary of this FDP, to please present this memento to Dr. Gaurav.
Thank you, Saurabh sir, for inviting me. Respected Pratibha ma'am, we are fortunate that you have accepted our invitation and delivered such a nice and informative, wonderful talk. And the talk is very informative, and participant is also providing their feedback, and they are also looking for your PPT. They want so kindly accept this e-memento on behalf of the organizing committee member of both institutes. Thank you.
Thank you. Thank you so much. Thank you for giving me this opportunity.